Did you want me to read it?
I can read it.
Okay.
No worries. All right. And I want to thank again Cindy and Alexia for being here. It's really nice to have you all. All right. So scenario one, the case of Adrian. Adrian is a 68-year-old woman. She lives with her husband Andrew, age 79, in a modest bungalow in a rural area about 10 minutes from town. Andrew was diagnosed with lung cancer with metastases to liver and bone 10 months ago. Andrew had been feeling unwell for several months before seeking medical attention. He now is very weak and spends most of his time in bed. He has pain that is poorly controlled and eats very little. At times, he is quite confused. There's a suspicion that he has brain metastasis, but his wife and family feel there is no need for further investigations. His physician agreed. Adrienne was born in Montreal, and she has several brothers and sisters in Quebec. Adrienne and Andrew have been married for 46 years. This is Adrienne's second marriage. She was married for 2 years to Pierre, a soldier in the army who was killed in Korea. Adrienne was left with one child, a daughter Isabel, now age 50. 3 years after Pierre's death, she met Andrew at work, and they married 2 years later. Adrian and Andrew had three children, a son Alistair, now age 43, a son Jean, age 36, and a daughter Anne, who died in a motor vehicle accident 10 years ago at age 24. Isabel lives in town nearby, but John lives in Seattle. The McPhersons have 8 grandchildren. Andrew has been a heavy smoker for many years. He's had hypertension and ischemic heart disease for about 10 years. He was a heavy drinker for a number of years, but he stopped when Adrian and he separated for a brief period of time. He does not drink alcohol now. He worked as an accountant with his own small office serving small businesses and doing income tax work. He is Scottish and has two brothers in Scotland. He and Adrian used to visit them frequently, and he's worried about how Adrian will cope after he dies. They live on their pensions now. Adrian has had rheumatoid arthritis for many years, but was able to continue working as a department store clerk until about 10 years ago when she had a flare-up of her disease. She is on multiple medications, but has been able to do normal activities of daily living reasonably well with Andrew's help, especially with household tasks. She is concerned about how she will be able to cope without Andrew's help. She does not want to bother her children for help. She has had to cope with the death of her first husband and her beloved daughter Anne, and feels that she cannot cope with another death in the family. Their marriage has been quite strong despite the one brief separation. For 2 years after the death of their daughter Anne, they grieved quite openly and they recovered slowly. Their children have been very close despite two of them living far away. They are both Roman Catholic and have been attending church fairly regularly. All right. So now we're at our panel discussion, and I'll let you, Bethany, if you want to go ahead and facilitate that.
Okay, thank you. Um, so to our panelists, so what treatment would you implement with Adrian?
I can go first on that one. So, going through the case study, I feel like something that would be helpful would be doing treatment goals around the warden task of mourning. And I don't know if you guys are familiar with that or have heard about him, but they're basically for that don't go in any particular order, right? So it's not you finish task one, you go to two. It's pretty much following where the client is at and serving in that way. However, something that will be really important in this one is add the adaptation for preparatory grief, right? Since it is a death that hasn't occurred yet, it is something that she's going through and experiencing. So that's where I feel like I would add the adaptation to these tasks. So, like I mentioned, there's four. The first one is accepting the reality of the loss. Second is processing the pain of the grief. The third one is to adjust to the world without the disease. And the fourth, to find an enduring connection with the disease. So as we go through these, you can see where we can add the preparatory grief implementations, right? So accepting the reality. I'm sorry about that. Let me take some water. That's what happens when you go too fast. But going back to that, accepting the reality of the loss is where you can come back to that and kind of add the grief implementations. Processing the pain of the grief is something that will be really helpful since the person is still there. I know that the case study does mention that Andrew, has some moments where he's confused, and I would anticipate just kind of assessing with the client moments, and if it's even possible, where they can have conversations, right, or plans, or maybe even processing those emotions together, if it's possible. The third one, to adjust to a world without the disease, is where we go into roles. So the case study does mention a couple of roles that Andrew plays in Adrienne's life, right? Like helping her around the house, helping her with her illness. So just kind of assessing the roles that we have when Andrew is still there, and how would her life change when he passes. So we do have an advantage usually when the death already happened, right? We go through these rows and stages with the client, and they kind of have to assess that and kind of think for previous experiences, but now the person is still there, right? So this is where we still add that preparatory grief implementation. And then the final one, which is to find an enduring connection with the deceased. Again, this is a really helpful one that we can add the preparatory grief, because this stage has to do with how can I keep this relationship with my person when they're no longer here, right? How can I carry that relationship? Because we always say that death ends a life, but it doesn't end a relationship. So this is that stage where we help them connect, and taking advantage that her person is still here. It's something that they could do together and decide, okay, well, what would be something that I can carry from our relationship, right? How can I honor you? And in a way, when the person has already passed, right, we kind of just go with what our feeling is and what has been important to us. But since the person is still there, I feel like this could be a really healthy stage for them, because she would know when he does pass that I talked to him about it, and I know that this will be something that he would appreciate. So again, I will use the Warden task of mourning to create the treatment goals for this client.
Thank you. I can piggyback on what Alexia was sharing. I will be talking a little bit about Warden's task of mourning in the training in a little bit more detail later this morning for those of you that have more questions. But really, it's taking a person-centered approach. This is anticipatory grief, but also she does have compounding losses. It's the loss of her first spouse and her daughter, and so she has prior experiences. I would be curious to know how she processed those losses, if there's still unresolved grief there that we may want to explore, would be important for her. And really just holding space for all of her questions, her worries, her fears. I get the sense from the case study that she doesn't want to burden her children with the challenges that she's experiencing and the worries about moving on in life without her spouse. And so creating a space for community and connection is going to be important for this particular client. And I think that they have a really unique opportunity to build connections, like Alexia said. A lot of times, we work with families after the death loss, and a lot of times what we hear are questions that were left unanswered, right? Even when we're working with the children at the center, sometimes we might ask, what was your loved one's favorite color? And sometimes they don't know questions like that. And so creating opportunities for memories, not just with this particular client, but they have 8 grandchildren and 2 surviving children. And so being open to creating opportunities for connection with family members, I think would provide families so much opportunity for closure as well, and connection.
Awesome. Thank you both. So moving on to our second question. How would you include other professionals to provide treatment in an integrative approach? And I guess this is a follow-up question that can kind of go into the next one, but if you want to start, what resources also might be helpful?
I was thinking about medical professionals that we can include there, since the case study does mention that she's having a little bit of trouble and that he has been that support for her, right? So adding a holistic integrative approach where we have maybe like an at-home nurse or in-home caregiver that can help her with that. So we can set that up, and that would help her in the future. And also that would help Andrew um, in the present, since it does mention that he worries about her. So, and like you mentioned, going into a little bit of the other one, I was thinking about a multi-agency task force. There is sometimes services where you have, an all-around team, and with the case manager being that main one, because she is an elderly client, making sure that she has access to all of those things in one place or but through one person, instead of having to, call herself or set those up herself. I've had clients that are elderly, and it's really difficult. Like, they put a lot of effort into just making it to session, right, to counseling session. So definitely a goal is helping that to be an easier process for them. So case manager with a multi-agency task force, I feel, would be a great approach.
I'm going to echo what Alexia said, but also just being really mindful that often as a caretaker, many times caretakers find it difficult to meet their own needs because they are prioritizing the needs of the person that is ill. And so I think it would be really important just to follow up with the client on a regular basis in terms of her own medical care, her medication regimen, making sure that she is being consistent. And I would like to recommend, if it is within her community, a caregiver support group that I think would be really helpful. It is a very heavy task to be a caretaker for someone that is terminally ill. And so just having space to meet with other caretakers can normalize her experience and provide her a space to unpack some of the things that she's working through and the stressors that she's experiencing.
Okay, so that one kind of ties into our next one, so thank you again. What resources need to be developed within their community and or practice that will help their grieving patients? Well, this is for clinicians, right? For anybody who's working with the client. So what resources would need to be developed in order to help grieving patients? And how can we lead those efforts?
I would explore existing programs in the community first. Often churches or hospitals will host caregiver support groups or grief and loss support groups. So I'd encourage to explore what exists already. And then from there, if there are no existing programs, connecting with other professionals in the community who may be able to help implement a type of support group for individuals in this situation would be helpful. Reaching out to local universities is a great resource as well. And then there's numerous online programs. I know in this case, the client is a little bit older, but with the right support, she may even be able to connect to online platforms or support groups if none exist in her local community.
Yes, definitely. I would say the same, kind of seeing what's already there. A good one that sometimes if we don't have anything locally, we can reach out, and I always recommend, it's called NAMI, which is our National Alliance on Mental Illness, and it's a really good resource whenever you're looking for support groups or just anything that you think might be helpful for the client, but you can't seem to find yourself like on Google or from other colleagues, this is a really good number to call and share what you're looking for. And they're really, really good on sharing some resources or even finding stuff for you that you didn't even know was there. So another one, going back to the multi-agency task force, I feel like this is a really neat program that I've seen work with before. So I know that we're covering grief. I've seen this covered in children's advocacy. So clinicians serving abuse and that. So we have a multi-agency task force that meets, let's say, once a week, right? And going over those high-risk clients, which of course, in this situation, this will be considered one because of her age and just her background. So making sure that we are connecting her to the services that we have available. And that way, you know, everybody's on the same page and we don't have to be kind of like catching up. So I feel like that's a really good approach in the question that mentions something that we can implement as clinicians. So I feel like building a task force like that will be great in this situation.
Awesome. So the next question would be, when would you refer her to a psychiatrist, if ever?
I don't think we have enough information. I feel as if the case study does give a lot of background information, but doesn't provide enough information on her presenting symptoms. So at this point, I would not refer personally for psychiatric care. However, I would want to explore, you know, the impairment that this may have in her daily functioning, the stressors that she's experiencing. Along with the anticipatory grief and prior grief loss experiences. I would consider, you know, seeking or exploring the benefits of psychotropic medication if she was describing a significant impairment to her daily functioning or preoccupation with the loss or anticipated loss on a nearly daily basis would be what I would be most concerned with.
Yes, yes. So definitely looking at the symptomology and how that progresses, especially after the death, right? Keeping an eye on her and just assessing for that need. Definitely when there's a great impairment to either like social or her regular task, her daily task. And also I was thinking about if any presence of risky behavior were to show up with her. It doesn't mention anything like that so far right now, but that is definitely something to look out for. Any risky behavior like suicidality, self-harm, hallucinations, anything like that.
Thank you. So based on the information provided, what might be a diagnosis or diagnoses that you'd give Adrian, and what are the symptoms that support that diagnosis?
Again, I'm going to go with that there's not enough information in terms of her presenting concerns or symptoms. So with the information that I have now, I would not diagnose her with you know, any clinical disorder. I think that her experiences are natural reactions to the life experiences that she's going through at this time.
Yes, definitely. I read over the case study again, just making sure I didn't miss any like symptoms or anything like that. But I agree, it doesn't show or describe enough symptoms, or it does mention here and there, right, that she is worried about when the loss happens because she has dealt with previous losses before, but it doesn't really go into like behaviors or symptomology. So I wouldn't diagnose her with anything now. However, I would assess for prolonged grief disorder from the previous losses that she had with her daughter and the previous husband. And that diagnosis does require the 12-month period, which it is the case for both of the deaths, right? So just making sure that she's still not carrying that from the previous ones. I know it does mention that she is recovering, and it mentions how it was a slow recovery, but I would just make sure that we don't have a diagnosis for the prolonged grief disorder, which we recently just added to the DSM. So that was great for everybody in the grief field, right, to have the official diagnosis there. But the diagnosis is pretty much assessing for a persistent and pervasive longing of the deceased, which again, we're talking about the previous losses that she experienced. Intense emotional pain, which does require 3 symptoms of the 8 provided, which could be identity disruption, marked sense of disbelief about the death, avoidance of reminder that the person is dead, intense emotional pain, difficulty in reintegration to her life, and emotional numbness, feeling that life is meaningless, and intense loneliness. So again, 3 of those 8 are necessary for the diagnosis, which is not mentioned, but I feel like it would be good to assess for the previous ones.
Thank you. So this one kind of piggybacks off the last question. So what are some formal or informal assessments you might use in your session to, now we don't have a diagnosis, but maybe to assess for another diagnosis?
There are a couple of assessments, brief grief questionnaire, a structured clinical interview to assess for prolonged grief disorder. I would also probably want to implement something like the COPE inventory to explore how the client, her current client coping skills and responses to stress would be helpful, just to get a better idea of how she is managing that.
Yes, another one that comes up for me is assessing for depression. So the Beck Depression Inventory, just kind of seeing where she's at, mainly because of what she's going through now and her previous experiences. It just mentioned that, the loss of her daughter was a big impact, of course, for her. And so just making sure that depression or maybe even anxiety is not something that is there or causing impairment for her.
Okay, thank you. So our next question is, what suggestions do you have for novice professionals to be mindful of with Adrian when treating grief and loss, and maybe even some cultural considerations for treatment?
So I would say definitely being mindful of the previous losses that she experienced, like the ex-husband and the daughter. So just making sure, again, going back and assessing to make sure that there's no work that needs to be done there. I mean, of course, I know that that's definitely something that would still be impacting her, right? But just assessing that she's coping in a healthy way with it. Also, the religion, they do mention that they're Roman Catholic and that they attend church regularly. So making sure that you bring that to the table if they want and that if they feel comfortable, especially if it's a big part of their lives, right? We don't want to ignore it, even if that's not your religious preference, just making sure that you have those boundaries and that yours never cross to that treatment. So, and then another one, she's from Canada, so considering any culture regarding death and just in general, when it comes to that, it's always really helpful, right? When you see a client on your caseload and you know that they're from somewhere else, it's always helpful to look up the place if you're not familiar with it and just kind of know a few things, because them noticing that you know about it or you're familiar will help them feel comfortable and build that client counselor relationship or rapport. And if you don't, you can always ask, right? We don't have to be the experts in everything all the time. So just asking, tell me about your culture, right? Tell me about some of the things that you do is always a good approach as well. So Those are the ones that I came up with: the previous losses, the religion, and where she's originally from.
I know we have a lot of students on here and working with graduate students. We do have graduate students that complete internship with us at the center. I think one of the biggest worries or anxieties that they have is, am I going to say or do something wrong that is going to hurt the client more than help? And I always lean on holding space, that when you can hold the space for a client, regardless of whether you know what to say. Sometimes there isn't anything to say, right? Client may ask, why is this happening? There are some questions that we don't have answers to, but simply holding space for that client can be so valuable, especially in the case of this particular client. She has talked about not wanting to burden her children. So I wonder if she really has anyone to talk to, that she can air out her worries, her fears, her feelings and emotions that come with the loss. And so simply just providing that space for the client can be so helpful. So I would just stress for any of you that do work with a client that is in the area of grief and loss, that's the number one thing, right? Just building that relationship is so important. And also building community. A lot of times what we see with our grievers at the center is wanting to normalize that experience, that what they're experiencing is normal for that situation. And so knowing that other grievers experience similar responses can be really helpful for the griever. And another point that comes up for me is that grief, a lot of individuals believe that grief is purely an emotional response to the loss that has occurred. But it is a full body experience where there are physical, emotional, behavioral, spiritual responses to the loss. And so it's helpful to not neglect the other parts of her grief experience by just focusing on the emotions that are coming from this anticipatory loss, but also how is this affecting her physically? Is she eating well? Is she sleeping well? Is she taking care of her health? What does this do for her faith and spirituality? A lot of times we have grievers who may lean on their faith as a source of resource, and other times there's a lot of conflicting feelings because maybe their prayers were not answered. And so just exploring all of the different parts of her grief and anticipatory grief will be helpful to remember that grief is not just an emotional response.
Yes, and adding something with what Cindy mentioned about holding space, I feel like that's a great response for something that we get quite often when we have a lot of differences between the counselor and the client, right? In this case, since the question does mention beginner counselors, so the age gap could be a big factor there, right? Sometimes you have clients coming in and they feel uncomfortable seeing a young counselor and just saying, how are you going to help me with my issues if like I'm way older than you, right? I have more experience. So that response and what she explained about being there to hold space and to be there to hold her grief and to be somewhere where she can just come and let it out and help her through that. It's a really helpful answer for that, because I feel like that is a common one that comes up when we're just starting.
Alicia, did you have a question before we move forward?
Yeah, I actually had some like input for like the cultural consideration as well. So when reading the case study, I'm from Canada too, and I recently had a loss. And similar to the case study, like they mentioned there's family all over the world. Like there's a son in Seattle, he had family in Scotland. So I think even like going over with her like preparations for funeral when that does come to time, like how that could be exhausting, making phone calls to everyone. So even I guess like the preparations for the death, I think is a big thing, especially when everyone is separated and not everyone can attend or say goodbye. And for example, for my mom, she lost her dad And it was hard for her to communicate that with everyone, and also not having the support of people being there if they weren't able to make it. So I think even considering location-wise of her community and the family.
Yes, that's great input, Alicia. Thank you so much for letting us know, and I'm so sorry for your loss. But definitely, so you're thinking with that, what can I do for the client now, right, to make it easier or to help her? How can I support? And that's definitely a great goal that could be had on her treatment plan.
Yes, thank you. And so that kind of takes us to our last question here. So, in your own professional experience, what example can you share regarding clients with symptoms of grief and loss?
I have 110 stories to share. I've been with the center for 7 years now. So our primary and sole focus is grief and loss. Um, there is so much to say. But I will add something that I have found to be really helpful. Being trained as a play therapist, I do find immense value in the expressive arts and play, and creating space for other ways of expressing one emotions. Many times clients will come into the center and say that they don't know how they feel overwhelmed. And so creating opportunities for nonverbal ways of expressing grief can be really helpful, not just for children. I do this with adults. Sometimes we may paint what those feelings look like. Sometimes we may be creating music or sound. And so just providing the client different opportunities and forms of expression can be helpful. Because this is a very overwhelming experience for anyone who has experienced loss and is anticipating a very profound loss. In this particular case, the client has been with her spouse for over 40 years. And so this is a very significant relationship for her. And she may not have the words to express exactly how she feels. And so being open to the expressive arts, whether that's through music, through poetry, through writing, through art, are all very helpful interventions that can be utilized. So I just encourage you to explore that regardless of the age of your client. I find that a lot of times they find that to be really helpful in beginning to explore their personal experiences.
I would say that I've had many different types of clients, right? We get those that are ready to explore, that are excited, that have been waiting for a while just to have someone to process and to remember their person with, right? I've had the clients who just want information or psychoeducation, which we're more than happy to give them. We also have clients that want the help but need a little bit more patience, right? And how that looks like is they're coming to counseling, they're coming to their sessions, they're not missing any session, right? But when they're in session, they're a little bit shy and it's a little hard for them to share. But you kind of have to look for those signs that are there. Like they want the help, they just need maybe, like Cindy was mentioning, different approaches to help them get that flowing. And then, of course, we also have those clients who are not ready to process and are not just there. And we definitely never force that for them. We're just there whenever they need and give them information, right? Our center is always here. Our help is always there. When it comes to a personal example, I've had a family who came in to process the loss of their daughter. However, they were coming in mainly for the child, right? So child is not with grandparents, and so they brought her in for her to process. This was a group setting, and at the beginning, they were really hesitant to share, and they even expressed that they didn't believe in counseling, they didn't feel like that was helpful. And of course, we were always really gentle to just say, please take your time, you can share if you want, you can always skip. Because again, this was a group setting. And it's about 7 to 8 sessions. And I would say by the end, but the last session, they were the ones that would talk wonders just about how the sessions have helped them, and they would cry and laugh and just share so much. So it's definitely an example of, you know, how if you just hold that space and walk at their pace, that's definitely something that would help them. And of course, exploring different avenues. If individual counseling didn't work for them, that doesn't mean that group will not, right? Or vice versa. So just really exploring those options with them. And I've seen clients that come in or that want counseling, but they're not really sure because they had a bad experience before. And something that I always like to talk about, or I tell my clients, if you're going to leave with something with me, please let it be self-advocacy, right? Making sure that you can stand up for yourself or look for resources for you, because at the end of the day, counseling is for you, right? If you don't feel comfortable with that counselor, of course, always with that balance, right? Not just the avoidance of like, no, I don't like that counselor, but just making sure that they find a place where they feel heard, where they feel comfortable. And if it was a bad experience the first time, that doesn't mean that they would never find that person, right? Just helping them with that self-advocacy and knowledge of counseling.
Awesome. Thank you both so much for sharing those examples. I know a lot of our students like to hear what's actually going on in the field. And so if y'all wouldn't mind, I know we have like about 10 more minutes. If any students might have any additional questions, if we could just kind of open up the space for that. And I'll stop sharing my screen.
I had a quick question. I didn't know how to do like the raise hand thing. I'm sorry. But so regarding like culture stuff, y'all brought up like in the instance that there is like an older couple, like the case study where like they're losing their partner and not wanting them to be alone afterwards, given that they have their own health circumstances and things like that. Culturally, how would you introduce that to a culture who is a little more like hesitant in terms of not allowing outside help? Like I know like in my area and just in my experience, like personally, not like clinically, having like Latino culture sometimes like introducing like hospice care or things like that is a little more hesitant to do so. How would y'all introduce that in a way that that they would understand and not harm them as well?
That's a great question. I think first and foremost would be psychoeducation on what exactly hospice or palliative care is. A lot of times, clients may feel as if when that is recommended, that the patient is very near the end stages of life. That's not always the case. A lot of times these services can even be provided for longer periods of time, a year or if not longer, just kind of depends on the type of care that is provided. And essentially what they're looking for is providing comfort to the client, right? And so keeping in mind that they want the best for their loved one, that this is going to provide them the resources and tools to be able to comfort their loved one, is important, in just educating what exactly that is, because I think there's a lot of fear with admitting that you're putting someone you really care about in hospice. And the other thing that I wanted to add is, in my personal experience clinically, we're in the Rio Grande Valley, so a large population that we service is Hispanic and Latino, and very much that is that culture, right? We don't talk about it outside of our family. We're not going to tell your aunt, we're not going to tell so and so. We can manage that on our own. But I also see that a lot of times, even within that nuclear family, no one is talking about it. And so we have a lot of children who will say, well, I'm trying to be strong because I know mom's having a really hard time. And then mom says, I'm being really strong because my kids need me to be strong. So everyone's being strong for each other. No one's talking about it. And so a lot of the work that we do is also creating those opportunities for communication among family members, and knowing that really everyone has everyone's best interest in mind, but how can we communicate and come together? So a family like the one that was presented in the case study would be helpful to even encourage a family session so that there is open communication, and that they can create that system of support within each other if they're not open to getting that outside help.
I just wanted to ask more so along the lines of like diagnoses. So say you're working at like an RTC and you actively need a diagnosis for like insurance purposes. Would you look at something more acute instead of prolonged grief disorder? So maybe like adjustment disorder, something that's like 6 months or less. And if so, like what might they be other than adjustment?
Yeah, so for the prolonged grief disorder, it is the 12 months. So if you did need a diagnosis, adjustment disorder might be one to consider, or even exploring whether client has symptoms of depression or anxiety. A lot of times with grief, we even see clients who may meet criteria for PTSD, especially if it was a traumatic or violent death. So those are some of the things that maybe you would want to explore for other differential diagnoses.
Thank you.
I have a quick question. So as far as like in integrated care settings, what kind of interventions would you provide for someone with maybe a child who went through like TBI or perhaps like brain damage, that completely changes the kind of like psychological well-being of the child, but the child is still alive, so they're grieving something, but it's kind of a little bit I would say a little bit complicated. How do you navigate that?
I feel like support groups is a really good way to go about it, other than offering that individual one-on-one counseling, because we always say that group is magic, right? We try to promote that a lot, even at our center, because clients do get to connect and to just kind of feel heard and that they belong. The story that I shared earlier, it's not so much because the counselor was wonderful, right? And they did everything. It was more because that family got to connect with other people who were going through the same thing and then hear what they have done, right? The emotions that they have experienced in the case that you are sharing with us, right? I could just imagine all those feelings that are coming up for them. So just hearing someone else have those same feelings or maybe even going through the same experience is huge because they get to build that community. So I feel like that will be really helpful for a situation like that, other than, of course, connecting them to any medical care or case management that is needed.
I know we're short of time, but I also want to just add that acknowledging that it is a loss. Their child is alive, but there are a lot of secondary losses to that, right? Sometimes as a caregiver for a chronically ill child, they may have to leave their employment. There might be a loss of income. There's the loss of dreams and hopes that they had for their child. So there's so many losses that come with having a chronically ill child. And so just acknowledging that when it's not just the adjustment to the diagnoses, but also the multiple losses that are coming from that diagnosis.
And I want to add really quick, if you guys are interested in this field or just want to learn more about cases or just stories, I recommend like watching movies, right, about grief or reading books. I recently saw Suncoast. I don't know if you guys have heard about it. It's on Hulu, but it is about anticipatory grief. And I actually just saw it last night and I thought it was meant to be. But yeah, if you guys are looking for more information or just want to get a little bit more familiar, there's also for books. We have a book club at the center and we recently just read Once More We Saw Stars. And this is a book related to child loss. So if you just want to, again, learn a little bit more about it, those are some resources that I recommend.
I just had a question on the chat about online resources. So our area of specialty is grief for children and adolescents. And a great resource is the National Alliance for Children's Grief, NACG. I believe their website is childrensgrief.org. And they have numerous trainings and workshops available. Great resource for books, workbooks that you can purchase through the NACG website. And they also have a search tool that allows you to search by city, state, or zip for other bereavement centers throughout the nation, including grief camps and things of that nature. So that's a great resource to help you connect with other providers throughout the nation.
Which we're on there, by the way, so.
What was the name of the movie again?
It was Suncoast.
Suncoast.
Yes, it just came out. It's great.
You can also follow, I was just gonna say, y'all can also follow us on Facebook. We do offer various trainings throughout the year. And so we also have a grief symposium in November. So if that's something that an area that you're interested in, I encourage you to follow us or visit our website for more information. Sorry, I didn't mean to interrupt you. I think it was Alicia that was going to.
It's okay. I just had a question, like in your guys' experience, do you ever see like the topic of financial stress come up with like medical bills and I guess funeral planning? Like how does that play in grief?
Absolutely. That's part of those secondary losses that we were talking about, that I mentioned just a bit ago, especially with the loss of a primary caretaker or a primary breadwinner. That is a big part of the stress and the adjustment piece to adjusting to the laws. Alexia talked a little bit about Worden's task of mourning, and that's task 3, which is adjusting to an environment without the deceased. There are numerous options. I know families sometimes are not aware of all of the options that are available to them. So we do primarily work with families after the fact, but there's also a National Foundation for Funeral Services. And a lot of times funeral homes may offer different options for families, including payment plans. So those are things that a lot of people are not familiar with. A lot of times funeral homes may say, it's X amount and you have until the day of the funeral to pay, right? And so that, especially for unexpected death, that can be very challenging for a family. But I'd encourage them to speak to the funeral home directors if that's something that they're concerned about. Same with the hospital medical bills. A lot of times they're willing to work with patients if they're not able to have the means. But we do want to work, right? Grief is not in a bubble. There's so much that happens aside from the primary loss. There's a lot of secondary losses and stressors that come from that.
Thank you.
I just wanted to say, I remember I had taken a tour. Cindy, you had given me a tour of the bereavement center, and you had so many amazing things to show me. You had a music room, you had a sand tray room, you had a place where people were doing arts and crafts. You also had really great food there. So do you want to just speak real briefly about like what are the activities and sort of like what the environment is like there?
Absolutely. And if you as an incentive, if you stick around to the training, I do have a short video, virtual tour of our center. But we are an expressive arts facility. We're the only one south of San Antonio to provide services for children in the area of grief and loss. We do utilize the expressive therapies. We know that children don't have the knowledge, language, or the life experiences to be able to understand and express their grief. So we meet them where they're at developmentally. We have in our Harlingen location, that's where Alexia and I are at. We have 2 playrooms. We have a see-and-trade therapy room, a music room, an art room. We just created a sensory calm space for children that are neurodivergent. And then we have just like the traditional counseling spaces. We do provide individual counseling, family counseling, peer support groups, grief camps, and training and education. All of our services are no cost. So that's really such a blessing for us to be able to provide that to our community without that financial barrier.
Thank you.
Thank you. Thank you so much for having us. It was a pleasure to share our knowledge and experience with you all.
Yes, thank you so
Yes.
much for being here.
And
So-
reach out if you ever want more information. I will share our phone number, and you can always reach out for services or just psychoed.
Thank you, Alexia. So we are going to go ahead and take a break, and we're probably going to come back then around like 10:17. We'll take a 15-minute break, and then we'll begin with our training.
Thank you again, Alexia and Cindy. I know Cindy's gonna be back to train us, and of course, Alexia, if you would like to stick around. If not, I just want to say thank you so much for being here. Yeah, and for all the amazing resources that you've provided.
Thank you for having me.
Thank you. See you all in a bit.
Okay, everyone, I think we're gonna be ready to come back now. If you're able to turn on your cameras, that would be an immense help so that we know that we're ready to go.
All right. I guess I'm ready to go. Yes. All right. I'm assuming everyone that was here this morning is still here. But if you are just hopping on, my name is Cindy Waddle. I am a licensed professional counselor, a registered play therapist, and the program supervisor for the Children's Bereavement Center, Rio Grande Valley. I'm going to go ahead and share my screen. I believe most of you already received the PowerPoint presentation, so you can follow along. If not, I can definitely email it to you afterwards. feel free to ask questions along the way. I certainly don't mind. I want to be mindful that we have enough time to answer all of your questions. And yeah, we'll get started. So I do want to take just a minute or two to share a little bit about the Children's Bereavement Center. I know that some of you are from the Coastal Bend area, and so you may have not heard about the Children's Bereavement Center. We are the sole provider for children's grief in the lower Rio Grande Valley, and the only provider south of San Antonio. In San Antonio, we have the Children's Bereavement Center of South Texas. Our mission is to support grieving children and their families after the death loss of a loved one. And our hopes is that we can provide healing with no financial barrier to families. I do have a brief video. I'm going to skip through it just in the interest of time, so that you all can get an idea of some of the work that we do at the center and how we utilize and integrate the expressive arts interventions in the work that we do. So actually, let me stop this, and I have the video loaded. I'm going to skip around it so that we have ample time to cover all of the material for the training.
As you walk up to the Children's Bereavement Center, you will be greeted by our wall of hearts. All the hand-painted hearts were created by our families in honor and memory of their special person who has died. Each tells a unique story of love and loss. The welcome space at the Children's Bereavement Center models the cozy comforts of home. This space is multifaceted and the heart of this center. The living room is a place where families can find comfort and connection. It not only serves as a waiting area, but a place for gathering. The adult peer support groups meet here on a regular basis, while at other times it is a fun and inviting space where children and teens play and interact during our grief camps and other special events. The library provides an inviting reading nook that is a favorite amongst our families. Reading serves as a coping tool for many during times of grief. It provides a way to make sense of the loss and a moment's respite into a different world. The dining area is a place of gathering, sharing, and learning. Families are often found sharing and creating a community of hope. It is also a place for learning when the center hosts Grief Education Institute workshops. The center is equipped with 7 therapeutic spaces. Each room is designed to provide grief counseling to clients aged 3 to 24 years old and their adult caregivers. The ranch room is a sophisticated and warm space. The ranch room, like all the therapeutic spaces, is used for individual, family, and peer support group sessions. At CBC RGV, we understand that grief is experienced and often cannot be put into words. CBC RGV is an expressive arts center, the only one of its kind south of San Antonio. Each of our rooms opens the door to an opportunity to express grief through the use of expressive arts interventions. In the music room, clients are invited to express and process their grief through sound. We know that children grieve, and we know that children grieve differently than adults. Using the child's natural language of play, our play spaces help to provide a safe vehicle for expression. Grief does not end. As a child develops, so does their understanding of their grief. The toys, costumes, and art supplies help them express their emotions and gain skills of resiliency. The Santry Room offers a myriad of miniatures that take on the meanings given by the individual working in the sand. In this space, the miniatures are used in the sand to externalize thoughts and feelings, breaking down barriers through a tactile experience. The sand tray is a container to hold their stories and explore experiences. The art room is a creative space filled with supplies, creating a limitless canvas of expression. When families first come to the Children's Bereavement Center, the first expressive arts experience will take place in this room. The paint, paper, yarn, glitter, beads, and materials are used to convey each individual's grief journey. This experience is powerful for families as they become aware of the uniqueness of their personal journey. Each child that comes to our center is given.
I am going to stop it there. I think the next thing is our Buddy Barn, which we do give to children a stuffed animal on their first visit, and that's just a symbol of the comfort and support that they feel. We hope that they will feel at the Children's Bereavement Center. So that gives you a small glimpse of our center and the different modalities and interventions that we utilize with our youth. And not just our youth, as I mentioned in the earlier panel case study, that we also utilize it with our adult caregiver clients. At TBC, we utilize expressive therapeutic modalities to help express, release, and integrate our awareness of grief. As I mentioned, we don't always have the words to express these big life experiences, and so we utilize these interventions to support families in gaining awareness about their grief responses. So a little bit about our training objectives. I will cover with you a little bit about how children and adolescents perceive grief from a developmental standpoint, the different responses and manifestations of children's grief. We will talk a little bit about factors that influence the grieving process. Alexia earlier this morning reference to Worden's 4 tasks of mourning, so I will go a little more into detail about that, and I will be providing you an intervention that you can utilize for each of the tasks of mourning. So just a quick overview about the services at the center. If you know someone who may benefit, unfortunately, right now we're only servicing the 4 counties in the Rio Grande Valley. So that's Cameron, Hidalgo, Willacy, and Stark County. And we hope to further our reach, but currently that is our service area. We do like to be a support to others, other providers. We do get a lot of times counselors or therapists or other mental health providers who are seeking guidance or support. So I'm always willing to be a resource, whether that's giving you websites, books, or other materials. I'm happy to help as much as possible. We do offer individual counseling, family counseling, peer support groups, and camps. We will be having a camp next month, our teen camp that's open to middle school and high school students. In the summer, we offer a family camp, and then during Thanksgiving and the fall break, we do Camp Shelby, which is for 1st through 5th grade. We're always looking for volunteers or interns. So if you are interested in the area of grief and loss, please feel free to reach out. I'll drop my contact information in the chat a little later. So I'm going to start with talking a little bit about what is grief and bereavement. These words are often used interchangeably. However, they have very distinct definitions. And so I went ahead and put this in kid speak. This is how I explain the difference between these terms to children, and I find that it's easier for people to understand and differentiate the difference. So grief, often how I explain it to children, it's what you think and feel on the inside. So this is a very personal experience for the griever, and these are often internal responses to the death loss. Mourning, on the other end, is the outward expression of our loss. Mourning often is very cultural, so depending on how that individual expresses their grief, that may manifest differently. So some families may choose to mourn by putting a table or an offering table in their home or an altar, lighting a candle for their loved one, doing gravesite visits. Those are all expressions of mourning. It's the outward expression of our internal experiences. And then bereavement is the period of time in which we adapt to the loss. So you often may hear people say, grief never ends. It's a lifelong journey. That is absolutely correct. We will continue to experience that loss throughout our lifetime. However, our hope is that clients will be able to gain the skills to be able to cope with those heavy emotions so that they no longer interfere with their daily functioning. So the period of bereavement is that time period where they are still adjusting and having those challenging experiences with adjusting to the loss. Once they resume a new normal and feel as if their grief is no longer interfering, they're no longer in that period of bereavement. Does that make sense? I find that just explaining it in this way to children can be helpful, and just we don't ever correct anyone or correct a child, but we do like to model the proper way to express the differences between grief, mourning, and bereavement. My slide, oh, there we go. I did also provide a secondary handout. I'm not sure if you all received it. If you didn't, again, I'll be sure to email that to you after the training. But I do have just a quick summary on the following slide. What I do want to share about how children grieve developmentally is that children do grieve differently from adults. A lot of times adults will ask us, or caregivers will ask us, or tell us that they don't know if the child understands or is grieving because they're not expressing those responses in the same way that we see in many adults. So it is important to recognize that children grieve intermittently. That means that they will grieve in small periods of time or small bursts of time. Unlike most adults, when we grieve, we can grieve for long periods of time, right? We can wallow in those emotions all day and kind of sit in that space and the heaviness of those feelings. However, children don't have capacity to hold those big feelings for long periods of time. So they're going to do them in small bursts of time. They may be sad and crying for 5 minutes, and then they're being a typical child and laughing and playing 5 minutes later. That doesn't mean that they are not grieving. It just means that they don't have the capacity to sit with those big feelings for a long period of time. If you've ever been to a funeral, you may have seen if there's any children. For example, at a funeral home, often you might see the kids running around in the lobby, playing tag or playing on their iPad with their cousins. At a glance, it might seem like they don't understand or they don't grieve. That's not the case. They just are not going to show us in the same way that adults express their grief responses. The other thing is to recognize that children re-grieve at each developmental stage. This is something that we do like to educate caregivers on. It can seem overwhelming and daunting to them when we tell them that their child will continue to re-grieve that death up until they are young adults. That is why we serve up to the age of 24. Because we want to reach them through that developmental process. That can seem overwhelming. It doesn't mean that the child will need professional support throughout each developmental stage. It just means that they're going to reprocess the death at each developmental stage. And some children do come back. We have had children who have received services and successfully completed their treatment goals. And then we may see them a couple of years later when they're in the next developmental stage. So that is just a natural response to how children will process the death. So this slide does have a brief summary of the handout that was provided to you. The handout that was provided does have a description of natural grief responses for children, ways that you can support them as well. And so feel free to utilize that and share that with any caregivers who may benefit from that information. At the center, we do start to work with children at the age of 3. But I did like to include this first developmental stage, which is from birth to roughly about 3 years of age. They have no understanding or very limited understanding in their early age of 3 of what death is. However, they do understand that something has changed in their environment. The best way that I can explain this is if you've ever walked into a room and get the sense that maybe the people in that space were arguing or having a disagreement, you might not have the evidence, but you can almost feel that tension in that space, right? Something has changed. You have that sense that something isn't sitting right. And so for children, a lot of times, especially if it's a primary caretaker who has died, the surviving caretaker may not have the same emotional capacity to meet the child's developmental needs, right? So they may not be nurtured as much or given the attention that they're needing or seeking. And so they do get a sense that something has changed, but they can't quite explain or understand what death is. As they get a little bit older during the preschool age, at the center, we call these our little hearts or 3 to 5 year olds. Excuse me. They do begin to understand that death has occurred. However, they see that as temporary or reversible. So here we want to be very mindful of the language that we are using with children. At the center, we utilize words like dead or died. When speaking about death loss, we do refrain from terms like passed away, gone away, is no longer here, is in a better place. Those types of metaphors and euphemisms are not helpful for children. If you think about where they're at developmentally, they are concrete learners. They understand the world through the things they feel, see, and touch. So when you say things like gone to sleep, they may ask, well, why are you crying? Let's just wake them up. If they went missing or gone away, let's go find them, right? So they're going to take that very literal, and that can often be more confusing for the child. So we encourage caregivers and we utilize the language that is concrete and easy for them to understand. We often say, like, even with our cell phones, right? My phone died. Or often through media or games that they play, many times characters may die and come back. So giving mixed information can cause more confusion for the child. And so that is always encouraged. Again, we never correct anyone. If a child says passed away, we don't correct them, but we want to model that. And we have found in our experience that most of the time, as we continue to work with the children and model that language, they will begin to use it and have a better understanding of life and death concepts. As they get a little bit older, ages 6 to 7 approximately, they do begin to see that death is permanent, but they also feel as if they are excluded or are not aware of their own mortality. So death can happen, it can happen to others and not me. They also may believe that they can escape death by being very good, or the opposite, by being very bad. I remember working with a child who began to act out, and after further exploration, he shared that he had been told that his loved one had died and was now an angel, and so he was determined to not be heaven material, that an angel would not want him. And so he started acting out with that idea that he did not want to die, right? And so if I'm very good, an angel will want to take me. So we just want to be, again, very mindful of the language that we are using with children. And they do begin to identify death with a physical presence or a tangible representation of what death is, right? So that might be if they're spiritually or religiously inclined, they might think that God or an angel or some spiritual being physically comes and takes their loved one. Or on the reverse side, some type of a spooky creature may be what represents what death is. I remember working with a young child whose mother died from cancer. And she was coming to the center maybe about age 8. So she was just kind of leaving this developmental stage. And she was reflecting with me that she thought for a long time that cancer was a being, like this presence, this physical creature that was causing harm to her mom. And so when people would say, oh, she's trying to beat cancer, she was imagining cancer to be a physical presence that was doing this to her mother. And as she was coming to the center, she was leaving that developmental stage. And she kind of came to this place where she's like, oh, now I understand. Cancer was something that was happening to my mom's cells in her body. But that's just kind of an example. And again, just being really mindful of their understanding of where they're at developmentally. A lot of times we hear children being told, your loved one is always with you, or daddy's always watching you. Again, they can take things very literally. We had a child that we were servicing at the center who began to have a lot of fears related to going to the bathroom and taking showers. It was with further exploration that the child disclosed that she was fearful that daddy was watching her while she was going to the bathroom and showering. And so that's where that fear was coming from, because she was told that he was always watching over her. So just, a lot of times these things are shared with children because we want to provide a source of comfort. However, again, just being really mindful that they are concrete learners at this stage. And so we want to support them by using language that is going to help them better understand these experiences. As they get a little bit older, between the ages of 7 and 11, they do understand that death is permanent and reversible. They also begin to gain awareness of their own mortality. And this is a period in time where they begin to have a lot of very vivid questions or ideas about what has happened. We do see a lot of referrals for children in this age range. I would say typically like 3rd through 5th grade. They may begin to ask questions like what happens to a body after it's under the ground. They may begin to ask, but what exactly happened? What parts of the body were impacted if it was an illness? These questions can make a lot of adults uncomfortable, but this is where they're trying to really understand death in greater detail. And so we have to be really patient and provide them that support and clear and honest information so that they can begin to process that death in an age-appropriate way. Typically, as they're nearing middle school or between the ages of 12 and later adolescence, they do understand death very similarly to how adults grieve loss. However, we're also adding those very big feelings. A lot of times, caretakers for adolescents will ask us or tell us, my child is very irritable, she's angry all the time. I can't distinguish whether this is grief or if this is just part of her adolescent, the development of an adolescent. A lot of times, we really can't distinguish, right? And what I often tell caregivers, it's probably both. Grief is already a very big emotional response, and then you're adding all of these new emotions and hormones that the child or adolescent is experiencing can magnify those grief responses. So when I was mentioning that grief is developmental, children will re-grieve the death at each developmental stage. So for example, if we have a child who's coming to the center at age 3, they have very limited understanding of the death. So we may work with them in understanding life and death concepts, that the person that died is not coming back. We may help them understand the emotions that are coming up for them as a result of the loss. And they may come to a place where they are coping well. However, as they get a little bit older, let's say now they're 9 or 10, and they're given more information about the death, they may reprocess that loss in a new and different way. And the same in adolescence, right? A lot of times they're experiencing new milestones, whether that's getting into sports in secondary school or learning to drive, or having a sweet 16 or graduation. These are all milestones that their loved one would have been expected to be there for, right? So they're going to continue to reprocess that death. over and over as they go through each developmental stage. Again, it doesn't mean that they need professional support. It just means that they're going to reprocess the information with their new understanding of the world around them and what they know about death. Any questions here?
I have a question. So going back to the stage where they are more like in the concrete like development where like they take everything very literal, and you were giving like some examples as to that are confusing to them, like, oh, your dad is always watching you, right? So what can you say instead though? You know, like to provide it or like similar comfort that is at the same time not a metaphor.
Yeah, so I think even just comments like the memory of your daddy's always in your heart or always in your mind. You know, he had very good intentions for you, are ways that we may be able to support the child. I've just seen a lot of very maladaptive responses to those words of comfort. I remember having a parent share with me that the child her child had ran into a heavily trafficked street because her ball had rolled out onto the street, and was, you know, and she was lectured about, you know, how you can't do that. You have to be mindful of oncoming traffic. And the child was very dismissive, like, oh, it's okay, daddy's watching over me, and so nothing can happen. So just being very mindful of how we explain that to a child is important. So again, you know, I don't mean to neglect the spiritual or religious beliefs of a family, because that is a very important part of grief. So we can still introduce things like heaven, right? Often children, concrete learners, may think that heaven is a physical place that you can go to. So they might say, well, why can't I go there? Or they might say, I really want to go to heaven. And the adult might be thinking, oh, the child wants to die, right? Just understanding that they may view that from a concrete place. I've had parents share, I remember I had a parent share with me that she, for Christmas, she wrapped gifts from the deceased and then put them under the Christmas tree. And so that was incredibly confusing piece for the child, because they're like, well, I thought they were dead, but how did they go out and get these gifts and get them under the Christmas tree for me, right? So we have very conflicting information. So just being consistent in how we explain death, that when someone dies, they cannot come back. Even if they wanted to give a gift, maybe a better approach would have been, if, you know, so and so was here, this is what they would have wanted you to have, right? As opposed to saying this is a gift from heaven.
Okay, thank you.
Yeah. Great questions.
I have a question.
Mhm.
So I was wondering, is it possible that in regards to this developmental scale, that a child that's, for example, 13 is coping with death at the level that like a school age child 6 to 7 is? And if so, how do we respond? Do we respond as if we're treating a 13-year-old, or do we respond as if, or whatever their developmental level is with coping with death?
Thank you. That's a great question. I would err on the side of going with their developmental stage. So not necessarily their chronicle age. We do work with a lot of children who may be developmentally at a different level. And this is a general guideline. It's not, you know, hard set limits. I remember working with a 3-year-old who was caring for a chronically ill loved one, down to helping change feeding tubes and doing a lot of helping the parent with a lot of the medical needs of the patient. And so this 3-year-old developmentally was far beyond what most 3-year-olds would be at, right? So we're looking not just at their chronological age, but also developmental and life experiences, because some children may have experienced situations that older children may have not, right? So for me, that 3-year-old understood what hospice was, and understood a lot of the end of life processes that maybe an older child wouldn't. So we're looking at a lot of different things, but I would err on the side of going with the developmental stage. We also know that trauma and stress can also delay development, so we want to be mindful of that as well.
Thank you. That's very insightful.
Thank you. I'm going to play this song. It is a little bit it's a little cutesy, but also has some questions that children will ask that many adults find to be a challenging or difficult. And so I just wanted to share that because I think it is a great example of what a child may be experiencing and the questions that they may be asking. So let me switch over. One sec. Shut up.
Glad that I can ask you about things that I don't know. Like, when my body dies, I wonder, where will I go? Oh, where will I go when I'm dead and gone? Where will I go when I die? If my body's down in a hole in the ground, will I fly up in the sky? Oh, where will I go when I die?
Dead goldfish go down the toilet bowl.
Dead mice go out in the trash.
My sick cat disappeared at the vet. And Grandma came home in a pot full of ashes.
Will I be a ghost in a haunted house? Will I scare kids when I say boo?
Will my foot hurt when I kick the bucket?
I don't know, do you?
Oh, where will I go when I'm dead and gone? Where will I go when I die?
If my body's turned into smoke and burn, will I make a tear in your eye?
Oh, where will I go when I die? Hey, maybe you could dress me up and keep me around. Sit me in your kitchen chair. Then if you got lonely and you needed someone, well, I'd be right there. Or you could hang me out in the sun on your patio. I'd dry hard as a stone, and the wind would make music on me like a radio. You could dance to my rattling bones. Oh, where will I go when I'm dead and gone? Where will I go when I die?
If my body gives some parts to save kids, will I disappear like a sigh?
Oh, where will I go when I die?
Some folks say we go up to heaven where no one's cold or scared. I bet no one's lonely in heaven, they only let friendly people in there.
My questions make some people nervous. This stuff's not for kids, they say. I don't care if you don't know, I need to ask you anyway.
Oh, where will I go when I'm dead and gone? Where will I go when I die?
If my body's in a box down under the rocks, will I get cable TV inside?
Oh, where will I go? I bet nobody knows. Tell me, where will I go when I die?
I don't know how much of you all picked up from some of the questions the kids were asking. Would anybody like to share what they thought about the song or what came up for them as you were listening to some of the words that were shared?
So I'm the oldest of 4, and like I've heard all of those questions. Like they seem like a little abrasive or out of pocket, but it's so genuine to like how a child just like transparently communicates what they think of surrounding like death or like death concerns, where they think they go. So I thought it was pretty on point. It made me like laugh a little, but not out of like death, I guess, but like because I've heard it, I guess.
Thank you for sharing that. Yeah, abrasive is a good word. Yeah. Any other thoughts or observations?
I one line that like stuck out to me was only nice people go to heaven. And I think something like take into consideration is like the cultural and religious aspects, but also like validating the guilt that the child might feel and helping them process that. Because yeah, it might be a little complicated to like work with their way of thinking that only nice people go to heaven, but like, yeah, balancing out the cultural considerations and also the guilt and shame that the child might be working through as well.
Absolutely. And also recognizing that not everybody who's experienced the loss had a positive relationship with the deceased, right? So what if the person that died was maybe an abusive father, right? It is, my daddy was not a good person, so does that mean he doesn't get to go to heaven? And what are those conflicting feelings that come up with that? Some of the themes that come up in this song are a lot of confusing, right? So my dead goldfish went down the toilet, and then there was an animal that was thrown in the trash, and grandma came home in a pot full of ashes, a pot of ashes. And so there's a lot of conflicting information about even how we handle different types of deaths. And so for a child, they may have a lot of questions. I think one of them said, like, will I get cable TV if I'm in a box under the ground? I've had kids ask me, like, do you think my brother poops in heaven? So those are questions that are going to come up. I remember working with a child whose father died, and he was asking, the ashes were split between the grandparents and his family. And so he asked me one day, just out of nowhere, and he said, do you think I have his legs, or do you think I have the head? Like, who has what part of the body in their urn? And so those questions will come up. And a lot of times, in the previous slide, I talked a little bit about how we get a lot of referrals during that developmental period, is because children will start to ask a lot of questions in this period of their development. And it may make the adults in their lives uncomfortable. And so just recognizing that this is a natural part of their development, where they are beginning to be more curious about death and life, end of life processes. And so just being patient and listening to them is going to be really helpful. And I'll talk a little bit in the next couple of slides about some interventions you can utilize and just responses that are appropriate for these types of questions. So just, I'm going to touch briefly on the different manifestations of grief. So I mentioned this earlier during the case study. The grief is not just an emotional response to loss. It is a full body and spiritual experience. So children who are grieving, and this is not, I know our focus here is talking about children's grief, but this is really applicable to all ages. Grief is a very physical response for many grievers. A lot of times they will talk about feeling as if they don't have enough energy, feeling like they're in this fog-like state of mind, just kind of meandering from one task to another. They may be additionally clumsy. Again, that's kind of like that fog state of mind, right? We're just going from point A to point B, not always knowing how we get there. And so we have a lot of somatic complaints. We actually get a lot of referrals from pediatricians and school nurses who may have children that are consistently going to the doctor or going to the nurse's office and complaining of somatic complaints, tummy aches, headaches, body aches, aches and pains that are not attributed to any ailment or a medical illness. Rather, it's their grief responses manifesting in a very physical way. The same for adults. A lot of times adults will complain of headaches and body aches as well. So these are the physical responses. We do usually see a change in appetite and sleep disturbances, whether that's oversleeping, overeating, or undereating, or not sleeping sufficiently. Difficulty initiating sleep or waking up throughout the night. So all of this, of course, has, that snowball effect where we're not eating well, we're not sleeping well, we don't have the energy. It is going to impact also our emotions and how we respond to other stressful situations as we adjust to the life without the disease. Emotional responses that also come up. I know that the first emotion that many of us think about when we think about death and loss is sad, right? That is a natural reaction. But as I mentioned just a bit ago, sad is not always the primary emotion. Depending on the relationship that the person had with the deceased, will impact the responses that come up for them. Anger is a very common emotion that we see at the center, not just anger about the person dying. Sometimes there's anger towards oneself for how they reacted, responded, or behaved prior to the death. Sometimes the anger may manifest outwardly towards other individuals, whether it was someone who may have perpetrated the death, or even the medical staff that maybe didn't do enough. Sometimes that's anger at God for not doing more to keep the person from dying. Feeling alone and isolated is also an emotion that we see quite a bit. And that's why we stress so much building that community, whether that is through support group or with one's own family. Many times grievers will grieve alone. We do a lot of family-oriented activities at the center. And so we create opportunities for sharing and discussing one's own feelings with their family members. And often what we will see is if it's a parent or a caretaker, they're trying to peek into what the children are writing or creating because they also feel very much isolated from their children's experiences because everyone is trying to shelter one another from their grief responses. So it can be a very isolating experience. And a lot of times even we have a lot of adolescents who really enjoy our support groups because they may share, well, I've got a really good support system at home. I've got a lot of great friends. I'm in sports and extracurricular, but none of my friends have had a mom who died. And so again, even if they have that support system, they may feel alone in that grief experience because it's not shared with someone who's going through something similar. There's a lot of fears and worries. A lot of times kids will manifest new fears and worries, worry that somebody else will die, something bad might happen, and that can definitely amplify in time as well. They may be confused if they don't have clear or honest information or they don't understand what has happened. Another one that I really want to point out is also guilt along with relief, especially when we are talking about individuals who've experienced the death, loss from a chronic illness. I remember there was an adolescent that was coming to the center and she had a chronically ill parent. And as a result of that illness, really didn't get to participate in the activities that most of people her age were doing, like going to football games, attending homecoming and prom, because she was tending to the illness of her parent. And so when the parent died, the teenager felt a lot of sense of relief because now she was going to be able to do all of the things that her friends were doing and were expected for her developmental stage, right? And so with that relief followed a lot of feelings of guilt that she was finding happiness and pleasure in not having to take care of an ill parent. So those feelings that we don't always acknowledge outwardly. And so we want to create space so that the client can express and process all of these feelings. I do like to share with clients that it's not so much about good and bad feelings, but these are just natural responses to their life situation and to the loss that they've experienced. As to not to shame anyone for having a particular feeling. We do get a lot of referrals from school professionals and educators because of behavioral issues that are happening with the child. So they may begin to see drastic changes in the child. A lot of times that does manifest as acting out behavior, whether that's at home or at school. Sometimes caretakers may say, my child is always crying. And then we have parents who say they cried, at the funeral and then they never cried again. again, there's no right or wrong way to grieve. And one thing that I always remind caregivers is that grief is not just sadness. So there might be an expectation that the child needs to be crying on a regular basis, that is an indicator for most people that the individual is grieving, but that's not always the case for everybody, right? So just normalizing that as well. We do see a lot of regressive behaviors, especially with children in the earlier developmental stages. So children that may have been potty trained may regress. They may be wetting the bed, having bathroom accidents, engaging in baby talk, sucking their thumb. Those are all very natural reactions to grief. Even adolescents will regress. However, that is going to look differently. So typically, regression in an adolescent may look as if they have a difficult time self-regulating. They may be also having tantrums or acting out behavior as well. We do see them having a decline in academic performance, avoidance behaviors. A lot of times, even like the excessive talking and yelling. Sometimes children may become excessively clingy. We have a lot of parents that say, I go to the bathroom and my child's in full-blown panic because they can't find me for 2 minutes. A lot of times that excessive talking is also coming from that fear and anxiety. As long as I'm talking to you and engaging with you, I know that I'm not alone and I have your attention. When I'm not engaging with an adult, then that's where that fear comes in about what will happen if you're not within reach. So these are common reactions that we see. We want to normalize that, but also begin to address the root cause of some of these behavioral responses to grief. And then we have spiritual and existential manifestations of grief. We at the Children's Bereavement Center are not a faith-based organization, but we are very respectful and mindful of the spiritual responses that an individual may lean towards when they are grieving. And so just holding space for their own spiritual and religious beliefs is an important aspect of the work that we do. Some clients may share that they may lean into their grief as a sense of comfort and support, where other times they may distance themselves from that grief, from that connection to their spiritual religious beliefs because they're angry or upset that their wishes or their prayers were not fulfilled. And so we see kind of both ends, right? Someone who really leans into that, their spiritual community, and others that may separate from that. They may begin to have questions about the meaning of life. What was the meaning and purpose of the life of the person that died, versus also the meaning and purpose of their own life. And so being able to provide space to explore those questions is going to be helpful. And lastly, we want to utilize rituals and create opportunities for making meaning and connection. And I'll talk a little bit more about that when we go into Warden's task of mourning. And then we have the social manifestations, right? The isolation, separation, anxiety, loss of interest in activities. I see this a lot in adolescents. Reduction in confidence or self-esteem, especially if they had an enmeshed relationship with the person that died, or that person was someone that really was a source of that self-esteem and confidence, right? So if my mother was the one that encouraged me to try out for different sports or activities and was my personal cheerleader and gave me the words of encouragement and affirmation that I needed, and that person is no longer in my life, I may feel as if I no longer am capable because I don't have those affirmations. And so we do see sometimes some of that, and working through building that self-esteem and self-confidence may be a part of that treatment planning process. And then also naturally just the conflict between friends and family. It's unfortunate, but we do see it quite a bit where sometimes there are disputes between family members, especially if it's a parent that dies. Sometimes there may be conflict, or the wishes of one family member or may be different from that of others. And when those wishes aren't honored, it can create conflict. Sometimes when a parent dies, sometimes children feel or end up being completely isolated from that side of the family, right? So now that dad's deceased, mom never really got along with that side of the family. So I no longer see my paternal grandparents or aunts, uncles, or cousins. And so that's a secondary loss as well for some children and some families as well. And so what are some of the factors that influence the grieving process? We do see that the type of death is going to impact how a individual will process the death. I'm mindful to say that not one death is greater or worse than another, because all losses are equal in their own right. But the type of death is going to play a role in how the individual grieves. So often people think, oh, when someone dies from a long-term or chronic illness, that the griever has time to make peace with that death. But that is not always the case. It's not always an easy transition. It can be incredibly traumatic as well to care for a terminally ill loved one and see their health decline and feel helpless to support or aid in that process. We do work with all types of death at the center. So we suicide, homicides, chronic illness, and sudden unexpected deaths. And really there is no one easy death for lack of better terms, but the nature of the loss will definitely impact how the griever processes the death. Also, their ability to mourn outwardly. Sometimes those relationships are complicated. We've had families who have sought services where maybe it was a relationship that was not expressed outwardly. I remember working with a family who the father died. However, we were working with it was a case of infidelity. And so this gentleman had another partner and children, and they felt as if they didn't have permission to mourn because people didn't know that he was their father. And so the ability to mourn outwardly can definitely be a challenging aspect to the grieving process. We also saw a lot of this during the height of the pandemic, where many times families were limited to just 7 people in a funeral home. I remember working with families during the pandemic where families were having to watch the casket be lowered in the ground from their vehicle because they weren't able to be there in physical presence. And so all of those factors are going to contribute in how they grieve that death going forward. Also, their personal relationship with the deceased. It's important to not assume that the relationship was a positive or beautiful relationship, because it can be complicated and it could have also been a negative or unhealthy relationship. And so part of that is also going to cause ambivalent feelings, right? I'm relieved that the person that died is no longer here to hurt me, but also having conflicting feelings about those feelings of relief. And also they may concurrently be feeling sad about that death. Other circumstances that change within the home. A lot of times we see adolescents or even younger children that are parentified. If it's a parent that dies, then the surviving caretaker has to take on multiple jobs. Sometimes the younger children are left to care for one another. So what are the circumstances in the home that are going to impact how the griever is going to process that death? The level of functioning of the survivor. We do work with children ages 3 to 24 at the center, but we also provide support to the caregiver, because we strongly believe that the child will only do as well as the caretakers are doing, right? So if we're working with the child, but the parent is not getting the support and is severely depressed or has complicated grief, they're going back to an environment where the caregiver is not modeling healthy grief. And so if that is the case for any surviving caretakers, that is going to impact what the child sees and how they express their grief within that family unit. We're also looking at secondary losses. And this might be Sometimes, especially when there's a loss of income, we're looking at, does a family have to move homes? If they're moving homes, are they moving into a new school district? So now not only have they experienced the loss of a parent, but they've also lost their home, their school, their friends, and that support system. And so there's a lot of secondary losses that come up for grievers. Prior experiences to loss, if we think back to the case study from this morning, the individual in the case study had multiple losses, and that is compounding grief. We've had families who have a series of losses within a short period of time. I think back to COVID, we had a lot of families who were having multiple losses within weeks or months of one another, right? And so what was their ability and capacity to grieve one loss? And was that process in a healthy way? Or are we now dealing with compounding grief from multiple death losses? Their age and understanding of death, when we think back to the developmental understanding, is going to impact how they process the grieving process. Pre-existing coping mechanisms, if we had an individual who had maladaptive coping skills, if they were already engaging in self-harming behavior, if they have pre-existing suicidal ideation, or just poor coping skills, that may manifest or amplify in the midst of their grief as well. So did they have pre-existing healthy versus unhealthy coping skills is going to be another factor that influences the grieving process. And then, of course, their available support system. So all of these are just a few of the things that we're looking at when we are working with the death loss. It's not just the death in itself, but all of the different factors that are going to influence how that person is going to grieve the death of a loved one. Sharon, remind me again, are we going on until 12 or 1? I want to be mindful of the time.
1 p.m.
Okay, perfect. All right. I'm going to go ahead and cover maybe the next 2 slides, and then we can take a little break. But how can we support grieving children? You saw a little bit about the video with the center and the expressive arts that we utilize with our children. I'm also a little biased as a play therapist. I strongly advocate for play therapy and utilizing age-appropriate interventions with children. I have this video from the Association for Play Therapy, which I absolutely adore. So I'm going to go ahead and share that with you, and then we can process some of your thoughts.
Oh, hey, Andrew, how was school today?
Well, it was a very frustrating day. Tommy was teasing me about my haircut, and that was embarrassing. As a way of coping with my embarrassment, I became angry. I'm ashamed to admit it, dear mother, but I could not resist striking Tommy with my fist. While this act of emotional release did offer a moment's respite from my embarrassment, the victory was short-lived. The next thing I knew, Tommy had immobilized me with a headlock and gave me what is referred to colloquially as a swirly.
This isn't how kids communicate, but they do communicate in other ways. Play is a child's first language. When a child plays, they express thoughts and feelings that would otherwise remain hidden. That's why play therapy can be a powerful tool for addressing a child's cognitive, behavioral, and emotional challenges. Licensed mental health practitioners use play therapy to help children process their experiences and develop more effective strategies for managing their world. To learn more about play therapy and registered play therapists, visit a4pt.org.
Oh.
I really just need a chocolate milk on the rocks and a long soak in the tub.
I love that that resource, that video. I think that it illustrates really well our expectations sometimes of children, right? But that is not how they speak. I'm curious if y'all have any thoughts or comments on that particular video that anyone would feel comfortable sharing.
I think it is very real that a lot of adults kind of expect kids to be able to understand emotions to that level. Maybe not the vocabulary, but maybe to that level of recognizing what they're experiencing. Um, it also like makes me think too, like I used to work as an RBT, so various kids like on the spectrum too, how their level of understanding is also very different. And so I think it's really good insight, like in a humorous way, but also um sheds the light on that kids aren't going to be able to express like the vocabulary that we want them to, even the emotions that we want them to, and to go on their level is also like really important, even based like developmentally and things like that. It's just really, it was really entertaining too, just how it was placed, and just it was good. Like you can definitely use that for a lot of parents or guardians too.
I think it's even sometimes for adults, like it's challenging to get to that level of awareness and insight on their emotions and their coping behaviors associated with their emotions. So definitely also that, like whenever I work with adolescents, like the parents like wanting their kids to have this like deeper level of insight on like what is happening, right? Like why are you behaving like this when it's not really modeled in the first place, right? Like we, as a family, they don't really communicate. So even sometimes parents and adults, right? Like we have a hard time verbalizing our emotions and verbalizing why things are happening.
Absolutely. Thank you both for sharing. Sharon, you just took the words out of my mouth. A lot of adults don't have the capacity to do that. And so that's a really big expectation for a little person that still hasn't developed that emotional vocabulary, that self-awareness to be able to, one, identify and express what they're feeling, and two, to be able to identify what their needs are, right? What do I need to cope with this situation? I believe that video was done very well. I've shared it even with some parents as well, who sometimes have just unrealistic expectations for where their child is developmentally. And it's helpful for us to recognize that they may not have all of the tools or capacity to do that. And so how can we meet them where they're at developmentally? Of course, the video does advocate for play therapy, but even just the expressive arts, if you're not trained in play therapy, I think that there's a lot of tools and interventions that you can incorporate to support a young griever. And not just young grievers, as I mentioned earlier, even adults may struggle with this. And so giving them the tools to express and learn about their grief can be really helpful. So what does a grieving child need? One, they need to know that they will be cared for and who it will be. This slide in particular is something that I use as talking points when I'm speaking to caregivers about how to best support their child. A lot of times they're looking for tools themselves. They are often grieving as well. And so they feel this felt sense of I'm grieving, but I'm also holding my child's grief. And how can I best navigate that? And so many caregivers do feel very lost in this process. One, this seems very simple, right? But children are egocentric. The world revolves around them and how are my needs going to be met? Sometimes caregivers see that as insensitive. We've had parents say, it was the day after the death, and they're already asking me, well, who's going to do X, Y, and Z for me because mommy was the one that did that. And so it might seem like something very insignificant for the adults in that child's lives. But again, they're focused on how are my basic needs going to be met. I remember working with the little one. He was a preschool between ages 3 and 5, and mom had died, and they had a ritual on Fridays. They would go to Starbucks. and she would get him a vanilla frap. And so he so much wanted to keep that routine. And he would tell his new caregivers, I want the drink. And he would try to explain it. And they really just couldn't figure out what exactly it was, where it was from. And this was causing him a lot of distress. We were able to figure that out, and caregivers were able to meet those needs. But it seems like, again, something really insignificant. He was hyper focused. He was throwing tantrums about who is going to do this now that mom can't. And so, again, just finding ways to reassure the child that their basic needs will be met. Something as simple as explaining to them who's going to be the person that's picking you up from school, who's going to be the person to help you with homework from now on, and just their day-to-day needs, routines, and the people that are responsible for meeting those needs can really reassure the child and ease some of those anxieties and worries that they may have. They also need to know that they did not cause the death, right? If you think about magical thinking, a lot of times they may feel responsible for the death, and not just children, but also adults as well. So reassuring them that they did not cause the death can be a very important process, because they may have a lot of guilt that they're carrying with those thoughts and feelings. They need clear and honest information about the death. This is one that I find to be very important in that process. Many times parents are looking to protect their child and want to limit the amount of information that is shared, especially if it's a disenfranchised death like a suicide, an overdose, or homicide. Many times caregivers feel that information will be more hurtful than helpful. However, best practice shows for caregivers to give clear and honest information in an age-appropriate way. So an example, when we're talking about suicide with young children, we may say something along the lines of daddy made his body stop working, or daddy made his heart stop working, are ways that we can explain in an age-appropriate way what suicide is for a young child. As they get older, we may be able to provide more information when we feel they are developmentally ready for more information. Typically, in my experience, young children are accepting of just short bursts of information. As they get a little bit older, they will begin to ask questions, and that's a good indicator that it may be time to share more about the death. But one thing that I have found, especially now in the age of internet and technology, is that children have ways and tools to find out information that may not be shared with them. So I remember working with a family who had a death loss by homicide, and the child was told that the caregiver died in a car accident. One day the child Googled the person's name and found out a lot of information about the true nature of the loss. This caused a lot of harm for the child, because there was a lot of feelings and a sense of mistrust that everyone around her had lied to her. And so that expectation is, right, that our parents or the people that care for us are the one person that we should be able to trust. And when that trust is broken, it also changes their whole worldview. And so we, by providing clear and honest information, we're building a relationship based on trust. And we're also giving the child an opportunity to process that information in an age-appropriate way. Sometimes we have caregivers who will say, like some of the things I've heard is, if it's a suicide, well, I'm not going to tell them until they're 15 or until they're 18. And so we strongly discourage against that, because that child may be processing that death as what they believe to be true. So if they were told it was a heart attack, for example, they're going to process that death in that way. And then when they're shared the new information or the true nature of the death, they're essentially going to go back and reprocess the death again with the new information, right? And so in order to prevent that regression in their grief, we want to just share honest information from the beginning. We encourage and we provide this psychoeducation to parents, but at the end of the day, we want to be respectful of their beliefs and their choices. And so we want to create space for that. If they choose not to, we never pressure them to share. But we do like to provide that information so that they can make an informed decision in terms of what will be the best thing for their family. Children also want to feel important and involved. In our fields of grief, we often refer to children as the forgotten mourners, again, because they don't express their grief in a way that is similar to most adults. A lot of the adults in their lives may believe that the child is not grieving, and so they're not always included in that grieving process or the grieving or mourning rituals that are held. So even finding little opportunities that the child can feel important and involved, such as from planning a funeral, helping them, inviting them to pick the color of flowers or a special photo or a poem or a song, helps the child feel like they're involved in that process and that their opinion and feelings also matter. And even beyond those initial mourning rituals can be helpful for the child. They need to continue their normal routines and activities. This is about most important. We know that children thrive on routine and predictability, and that is no different during that mourning or period of bereavement, where we want to create as much consistency. We know that grief is going to turn someone's world upside down, and there are a lot of things that are unpredictable or different, but the closer that we can get to that norm, that sense of normality or routine, is going to help ease some of those anxieties and fears that the child has, because they know what to expect from those routines. I remember working with a family at the center who was already an existing client, and they had another very unexpected death throughout the time that they were with us. And the caregiver called and said, "We just had a death last night. We have family coming in from out of town, and the child wants to go to school." The caregiver was very concerned, felt as if the child didn't quite grasp what had happened. Mind you, she was an adolescent, so she did understand that death had occurred. And she really just felt like she needed to be at school. She knew that what was going to happen throughout her day if she went to school, that she was going to see her friend in first period. And that was predictable for her, versus having stayed at home would have been really out of her routine, right? And so just children need that and crave that. My suggestion to that caregiver was, your child's old enough to express those needs, and we want to honor them, right? If she needs to be picked up early, that's an option that you can coordinate with her. But again, that really speaks to how it is important for them to have that sense of normalcy as close as possible, all things considered. They need someone to listen to their worries, their fears, their fantasies. We don't always have the answers or solutions, but they need a place to put that, right? To externalize those experiences, and finding an adult that can do that can be helpful. They need ways to remember that, and that's another really important one that I do like to stress. I did a workshop, this was years ago, for professionals, for educators. And one of the participants in the workshop had shared from her personal experience. And I asked her if I could share this in future trainings because I found it to be really helpful. Her spouse had her spouse had died, and so when she came back to work, no one acknowledged the death. Later, she found out that the principal of the school had told all of the staff members not to mention the deceased because they didn't want to trigger her during the workday. So her first day back, everyone acted as if everything was normal and nothing had happened. And she described feeling incredibly hurt that no one had acknowledged this very profound loss that had happened to her. This was not with ill intentions from the administration at her school. I think that their biggest concern was, what if she cries or is not able to do her job, right? What really ended up happening was that she felt invalidated, that her loss and her feelings were not valid or worth recognizing or acknowledging. A lot of times, just as a layperson, we may be hesitant to talk about the person that died or ask how someone is doing because we're scared or worried about triggering the person, right? So if I say, oh, I remember your grandma always used to do XYZ, we may think, oh, I'm going to make her break down and cry. That is the exact opposite of what a griever wants. They want ways to remember, and they want to know that other people remember their person that died, right? We find incredible comfort in thinking about, oh, my teacher remembers my mom and the things that she used to do for our classroom. I'm not the only person that still thinks about her, but there's a lot of people that remember and still honor that life. And especially young children who experience the loss very early in their developmental stage, they may feel as if they do not have enough memory or awareness about who their special person was. So children may come to the center saying, I don't know my dad's favorite color, or what his favorite song was, or what his favorite holiday was. And so they may not have had that opportunity, but the other people in that child's life can help them find ways to remember and connect to the deceased. So if you're having pizza night, you might be able to say things like, I remember your dad always liked to eat pineapple on his pizza, as a way of helping the child feel connected and learn new pieces of information about the deceased. So just from the perspective of someone that works with grieving people, it's not a bad thing to bring up the deceased. If someone does cry or become emotional, it's not because of what you said. And so don't stress about that. It might be that those feelings were already there. And so just because we mention or talk about someone doesn't mean that we are necessarily triggering them. They may already be feeling those feelings already. And so it feels as if that person is honored and remembered by others, and that it's not an individual process for them. And lastly, they need adults to model healthy behavior. And I talked a little bit about this in the previous slide, but we do a lot of building capacity with caregivers so that they can support their child in that grieving process. So what do we say? What would I have said to that child that told me what parts of the body she had in her urn, right? We don't always have the answers. And so sometimes just acknowledging that for that child, a response that I might have said, that I remember saying rather, was, I wonder what you think. So I wasn't quick to provide an answer or a response. And the child already had formulated her own answer and felt comfort and peace with what she had believed. And so sometimes we can return that responsibility to the child and just ask them, right? Do you think that my grandpa is in heaven? I wonder what you think. And then often they have already a belief or a thought that they may be searching for someone to validate that belief for them. Sometimes we don't have words to comfort someone, right? And so being able to even say, I don't even know what to say, or I don't have words to respond to your experience, can be helpful. There's nothing wrong. We're not perfect people and we don't know all of the answers. And so just acknowledging that can be something that may be helpful. Saying, I don't know. If someone tells you, why did my mom have to die? I don't know. We don't have answers for all of these questions. We can invite them to talk about those experiences, right? Tell me about your mother, or tell me about, if they are creating a piece of artwork, we might say, tell me about the color red. What does that represent for you there? What makes you feel better when you miss them, right? We're exploring coping skills can be helpful part of that process to constantly and consistently evaluate what tools they currently have to cope with the loss. Excuse me. I talked about this earlier and I'll reiterate it again. I'm using dead and died. When you think about the work that we do that is so such an important process to utilize appropriate language to help the child understand. Again, I stress we don't ever correct anyone, but from my personal and professional experience, we have families who come into the center and are still very much struggling with accepting the reality of the loss. And so they shy away from using terms like dead and died. But as they get closer to resolving some of that complicated grief, they will begin to change the language. And that is a good indicator that they're making progress in processing that death. And so I encourage all of you to begin to practice that, even just in your day-to-day conversations, when you're talking to others. You know, start to practice using dead or died as opposed to passed away. They may sound cold. I know I get this asked a lot in our trainings or presentations. You know, I often get asked, well, what have you ever had a client or someone tell you not to use those terms? I think in the 7 years that I have done this work, I've had one adolescent tell me that she didn't like me to use dead and died. And then we processed those feelings, and there was a lot that was coming up for her. But with the exception of that one client, it really has not come up. And if nothing else, it helps to affirm and accept the reality of what has happened. Let's go ahead and take a small break. If we can come back at 11:50, and we'll cover the latter portion of the presentation, if that's okay. All right, we'll be back at 11:50. Thank you. Anyone so far?
I actually did have a question.
Yes.
So as we don't have a lot, well, I don't have a lot of experience as a counselor dealing with grief or loss. So how can I tell the difference between like normal or typical grief symptoms and some more serious like processing like issues with the client?
Yeah, great question. I think the best determining factor, whether this is adaptive or maladaptive grief, is really going to be how does that impair the child's or the individual's daily functioning. That does look different for children than it does for adults. So sometimes that can be miss sometimes when we're not looking at all of the factors, right? So is this impacting how the child is able to relate with other people their age? Is it impacting their relationships, their daily functioning at school, or their day-to-day responsibilities? Are there regressive behaviors, drastic changes in their behaviors are all indicators that they may be struggling with that deaf loss.
Thank you for answering my question.
I also had a quick question. In terms of like a child who is facing perhaps like the death of, or I'm sorry, one second. Not the death, but maybe their parent is chronically ill and perhaps they might be a lot of anxious feelings surrounding that. So what are some things that you can tell a child that with a like chronically ill parent or perhaps a grandparent who is coming close to death or dying?
That's a great question. So I think one important piece is going to be the psychoeducation and preparing the child with as much information as is available for them. Sometimes I have parents who will ask, should I bring the child to the hospital if they are of age to be able to visit a chronically ill person, or to hospice or a nursing home? It's really preparing them because that can be a scary or traumatic thing to witness if their loved one is on life support or hooked up to other life-preserving measures, to just prepare them for what they may see or experience. And so even just letting them know, right, grandma is hooked up to a machine, you may see certain things that you want to describe to the best of your knowledge. And so just providing clear and honest information and also giving children a choice. I even get this asked with funerals. Should I bring a child to a funeral? Is that appropriate or not appropriate? A lot of times, depending also culturally, whether someone believes that will be helpful or traumatizing or scary for the child. I always err on the side of just suggesting to the caregiver to educate the child as much as they can with what they can expect from that experience, and then giving them an opportunity to voice whether or not that is something they may want to do. Some children may find comfort in visiting a chronically ill person where others may not, but just educating on what that process is and the end of life process, if they do know, can be helpful for the child. Also, just to add, is building those lasting connections with the person that died. So I know a lot of times even whether that's social workers or therapists or child life specialists that may be working with someone who is ill, is creating opportunities for connection and building memories with the deceased. So sometimes I've seen some individuals do like handprints where they might do something with the handprint of the person that is very sick and the child, as creating keepsakes that they can later lean on for comfort and support, and rediscovering that relationship and that connection that they have with the person. So also just depending on how frail or ill that person is, creating opportunities that they can create mementos or keepsakes, or even sharing stories of the person if they're still verbal, that they may be able to reference to later in life.
Cindy, I don't know if this question had already been answered, but like someone had asked earlier if the bereavement center offers any virtual opportunities for any kind of services.
We do. So we do provide telehealth. It is an option that we have. There are limitations to, I'm assuming that the question is coming from to be able to service outside of our service area. We are limited because of our grants to serving certain counties. So there are some limitations. Sometimes we've had families who we may be able to support in different capacities. I've had families from the Coastal Bend area who've come to like our camps, our family camps, our teen camps. So we do try to open those up to a little larger of a range. But unfortunately, most of our grants do limit us to just the 4 counties in the RGV.
So you do have virtual services. It's just
Yes.
like in our area, they wouldn't necessarily qualify for that.
Yes, I would still encourage you if there's someone that you feel would really benefit from our support. If you're at a loss of resources or other providers, connect with us. We'll see how we can support the family. I've kept in touch with families who provided like consultation over the phone. Sometimes that in itself can be really helpful to normalize the child's responses. We've emailed or mailed brochures or other websites or resources. So I don't mean to like necessarily say like we're not going to be of any help. We do have certain limitations because of our grants, but we also want to be a resource. We know that there isn't a service like ours in your Coastal Bend area, and so we can be of any support. We would always want to be able to support you all as well. Right, any other questions? Thank you so much. Yes, Patricia?
Okay, I guess when you brought up limitations, it made me think of, do y'all deal with limitations such as kids expressing suicidal ideation or any types of attempts and having to go through that?
Yes. So we do work with again, grief is not in a bubble, right? We don't just talk about the death loss and what arises from that, but we do have sometimes individuals who have or are demonstrating symptomology for another potential diagnosis, whether that's anxiety, depression, post-traumatic stress disorder. And so those might be things that are stemming from the death loss. Self-harming, the suicidal ideation are all common reactions that we see in our grievers. And so we will work with them, but also being able to distinguish between a true suicidal ideation and longing to see the deceased and find connection with the deceased. A lot of times children will make comments such as, I just want to go to heaven, or I wish I was dead so I could see grandma again. Being able to screen that individual to determine whether this is just an extreme longing for the person that died or a true intent to end one's life. Sometimes that can get a little confusing when you're working with the young child, as they don't quite understand the difference between that and also what we have expressed to them, right? So we say, grandma is in heaven. They might think heaven is a physical place, as if we're driving to San Antonio, right? So they might say it with that frame of thought that I just want to go there to see her again, doesn't necessarily mean that they want to die. So being able to distinguish that through proper screening will be an important part of that process. But yes, we do see a lot of those situations where clients feel very hopeless.
Thank you.
All right. I know the presentation is very heavy on content, so please feel free to stop me along the way. I will do my best to answer your questions as they come up. So we had left off on what to say to a grieving child. And next we'll be talking a little bit about talking to children about grief. One is just being very genuine with them, expressing a genuine concern for their thoughts, their feelings, and their experiences without leading them to feel as if they have to experience or feel grief in a certain manner. So we can open that conversation by just inviting them to tell us, how have you felt since your dad died, as opposed to leading them to, you must be really sad because your dad died, because that may not be that experience for them. And so just inviting them to conversation, listening and observing. Sometimes, especially with adolescents, they're not always very forthcoming or very verbal. So creating those opportunities for sharing and listening to them will be vital to that relationship. limiting personal sharing. And I think that goes just on a general term with most of the work that we do, right? That we are in service. When we do share, it is because it is in service of a client and not because we're processing our own personal experiences. Just because I've experienced the loss of my mother doesn't necessarily mean that my sharing will be beneficial to the client, right? There are situations where that might be. So some instances where I may share from my personal experience might be examples of normalizing that grief response. So I might say something like, I remember when my dad died, I felt very confused. I wonder what you might be feeling when your dad died. So that might be an example of how you may share a small, tiny nugget to continue or encourage that conversation. But we don't necessarily want to lean on our personal experiences or feel like that is going to serve as a piece of connection, because it may not, and it may invalidate that client's experience. And then, of course, we want to provide them with resources. That is going to be a helpful piece in what we do, not just for the clients that we're working with, but the caregivers as well. So I talk a lot about education. That is such an important part of the work that we do, because the children are only with us for a small period of time. We might see them once a week or bi-weekly for 45, 50 minutes. And so they're only with us a small fraction of the time. And the caregivers are the ones that are really working with that child day in and day out. And so we can build capacity with the caregiver, and by providing them the resources and tools, they will be able to find more progress in that process. And I've even gone as far as providing resources for even their teachers. A lot of times with young children who have a difficulty with regulating, we might provide tools and resources, discuss the coping skills that are happening in the therapy room, providing handouts or examples both for parents and to send to school with the teachers, so that that is being reinforced throughout the child's daily routines. I did add in this piece because I find that a lot of times individuals feel as if they're not sure how to respond to certain comments from other grievers. And so these are just examples of ways that you can support a friend or someone that is grieving. So, hey, no need to respond. I just wanted to let you know that I'm thinking of you. I'm heading to get some coffee if you're interested in joining, no pressure. A statement like this communicates that you are there for them without any expectation. And so if they are willing and able to join you, they can do so, but also if they choose not to, that there isn't any pressure. More than anything, it's communicating that you're thinking about them and that you continue to be a source of support. Many times, grievers have a very heavy presence and support in the early days after a death. So that might be a week or two, even the first month after the death. And then that support tends to dwindle and really not be as present or evident to the griever. And so just little statements, text messages, and, can be really helpful for a griever who feels as if they no longer have that same level of support later on in their grieving process. Another helpful statement might be, I'm not sure what you need. I'm here for you if you want someone to talk to, but I'm also available if you just want someone to hang out with. Again, this gives your friend or the person that you care about space to know that you are there for whatever it is that you need. Sometimes a griever does not want to talk about the death or their grief or how they're feeling. They might just need someone to sit with them or someone to be there as they cry it out. And so just, again, having create that space without an expectation. I know a meaningful day is coming up for you. I'm thinking about you and here if you need me. Again, this communicates your understanding of what they're going through. That might be a holiday, a birthday, it might be the death anniversary of the person that died. And by communicating this, you're expressing your willingness to be available. Again, a lot of times grievers will say to us, there was a lot of people there to support me in the early stages, and now I feel very alone in this process. So just even having someone that can acknowledge that that day is going to be difficult for them can be very meaningful and can go a long way. I created study flashcards for you. I hope it helps take something off your plate. Let me know how else I can help. A lot of times we tell grievers, let me know if you need anything. Sometimes a griever does not know what they need, or they have a difficult time asking for help. So instead of asking how you can help, you can just simply offer a small level of support can go a really long way. For for a griever, that might be picking up a few essential groceries. If sometimes even the daily tasks like going to the grocery store can be incredibly difficult for a griever. So just showing up at their door can be helpful. We've had other parents share that at the weeks after the death, they've had friends kind of have Grubhub drop off dinner. That can be also helpful experience, especially when grievers find just the daily tasks to be a little bit too challenging. What else to not say? Bright side statements. Any of you find yourself saying at least, it might be best to just stop there, right? So at least they aren't suffering anymore. Again, that is just minimizing that experience for them. So if they're feeling sad, heartbroken, angry about the death, and we use statements such as at least, we're minimizing that experience for them, the emotions that are coming behind that. And instead, it's as if we're trying to patch that up, right? We're trying to rush that process and dismiss the emotions that come behind that experience. Sharing from your personal experiences. So again, I know what you're going through. I lost my mom too. Again, yes, we both may have experienced the same type of loss, but your experience and my experience are very different. So instead of leaning on what I went through, I want to be able to listen to what they're going through. Avoid unsolicited advice. That is one of our group rules that we have in our adult groups, is that we ask all of our participants to not give advice during group time. Again, because we want to honor that process for the griever and encourage them to find what works best for them. What worked for me might not work for you, right? So comments like, you should go out and do something fun, go distract yourself, or maybe you should start dating. It's been 3 years. Every person's process is going to be different. And so we just want to honor and support so that we can create a space of individuality and also autonomy, that they have the ability to make their own choices for themselves. We don't want to make assumptions. Again, like I said earlier, right? You must be so sad, or it must be so hard, or just assumptions that we do not know unless we ask. I personally have been told this one, you're handling your grief so well. And the first thought that came to mind was, this is just what's on the surface, right? So almost like a duck in water. On the surface, I may appear to be doing well, but underneath there maybe was a lot of hurt and pain there. And so just thinking about what a client is going through, I remember working with a lot of adolescents who say, oh, my teacher made a comment about how I'm doing so well and how I'm keeping up my grades so well, when really they were just really struggling with keeping up with their academics and extracurricular, and on top of that, carrying all of their grief. And so just avoid making assumptions, and instead maybe ask, how are you doing? How do you feel that you're coping with this situation? And then rushing the grieving process. I hear this so much from our grievers that we work with, that many times, although it is well-meaning, individuals who are not grieving with them may feel as if they are rushing that process, right? It's been 1 year, it's been 6 months, you shouldn't be this sad, you need to get out there. Again, we want to avoid that and understand that every person's journey is unique to them and that we want to honor and hold space for that person. When working with young children, we also want to be mindful of the verbal and nonverbal cues that they're giving us. If you think back to when we talked about the developmental stages of how children grieve, we know that children grieve in small pockets of time, they grieve intermittently. And so when you are working with a child, they may not be able to sit with you and talk about their grief for the entire session. That might just be more than what they have the capacity to do so. So when they begin to disengage, they change the subject, they physically move away from you or lose eye contact, they may have reached that limit, right? So we don't want to force that situation or force the sharing if they are not ready to do so, or if they have reached the capacity or limit for that session or that interaction with the child. Some children may be able to oscillate in and out of the grief, and so that's also something that you have to be prepared for. With some kiddos, they may be able to sit with you and do a grief-related or a directed grief intervention, and they may go and retreat into their play and then come back and do the work. And so again, that's their way of self-regulating and self-soothing and coming in and out of the grief. So that's also just a very natural reaction for children. So I'm going to talk a little bit about the task of mourning. I know Miss Alexia talked a little bit about this this morning. I'm going to go into a brief description of each of the tasks of mourning and an intervention that you may want to consider utilizing, so that way you have a few tools in your toolbox when you're working with grieving children and adolescents. I want to preface by saying this is the model that we use at the Children's Bereavement Center. There are multiple models that you may want to lean on or explore further. This is a model that we use at the center and that many grief centers and bereavement centers throughout the nation lean towards a warden and his task of mourning. Many of you have probably heard of Elizabeth Kubler-Ross and the stages of grief. That tends to be the most well-known model. That is not the model that we use at the center, primarily because a lot of the work that Elizabeth Kubler-Ross did was with individuals who were in the end stages of life and were coming to a place of accepting their own mortality. So that is primarily work that was done with people who were dying. And we are working with the survivors. So Dr. William Worden has done a lot of research with children and grief specifically, and how the survivors grieve a death is very different from a person who is in the process of accepting their own mortality. That is the rationale behind using this model. So as Alexia mentioned earlier, it is not a linear model. It doesn't mean we go from 1 to 4 and that we're done grieving, but it is a good indicator that the individual may be exiting that period of bereavement and adjusting to a life with the deceased once they've gone through the 4 tasks of mourning. They don't always do it in order. I have had clients who have come to the center and they may be very early on in their stages of grief, and they may be in task 4, and I'm thinking, all right, so this is going to be a short-term client. And then a couple of sessions in, we're like in task 1, right? So again, just be very mindful that it's not linear. They may be able to go through the task in different order or be tending to multiple tasks at the same time. So the first task of mourning is to accept the reality of the loss. This is to accept the death on not just an intellectual, but also emotional basis. A lot of times we know intellectually that the person has died, especially if we go through those mourning rituals, right? So if we went to a funeral or a wake, or we saw a body, we went to a celebration of life, or we're present at the time of death, we understand intellectually that the person has died and is not coming back. For children, young children, again, we remember that they don't understand the permanency of death. And so for them, task one is going to be a lot of psychoeducation. But in task one, we're not so much worried about them accepting intellectually that the person has died, but rather emotionally. So when you think about what does emotional acceptance of a death look like? We're thinking about those situations where maybe you walk into a room and you expect that person to be sitting in their favorite chair, or you walk past their bedroom and you expect them to be laying in bed, or maybe you have, for an adolescent, maybe they want their track mate and the first person they want to call is their dad. And so those automatic responses where we still believe that person is coming back or is still present in our life in a physical way, we may not have fully accepted that reality of the loss. Sometimes individuals may find themselves stuck in this task. So comments like, I like to just pretend my son is at college is one way that they have not fully accepted the reality of the loss. Or sometimes we have families where maybe the deceased person would travel a lot for work. My husband was a truck driver, and so I just like to pretend he's out on work leave and that he's coming back because it's easier for me to believe that than to accept that he died. So those are examples of emotional acceptance. For a lot of grievers, the first 1 to 3 months, they may struggle with accepting the reality of the loss. They may talk about feeling as if this experience is surreal, that it didn't really happen to them. It doesn't feel as if it's really hit home. Sometimes a lot of this is marked by not wanting to touch or move or put away the belongings of the deceased with that felt belief that maybe they will come back, right? So in task one, a lot of what we're doing is storytelling. We're inviting the griever to talk about the death so that that can become a more real experience for them. We are using terms like dead and died. We are creating space for repeated questions, for storytelling, and for just acknowledging the facts that are presented to them about the death. Here we want to just create space for accepting that reality. So a lot of what we will do with clients when we are tending to task one is inviting them to tell us about their special person. Tell me about your dad. What are some things that you remember about him, or what are some things you remember about her? And also another thing that I want to note on task one is that I personally like to also invite the participant or the client to begin to differentiate or separate themselves from that identity that they take on as a griever. A lot of times kids will talk to us about, oh, everyone at school knows me as the girl whose mom died. Or, oh, oh, you're the lady whose husband died in the car accident. And so sometimes that death becomes part of our personal identity, or we adopt that as an identity. And so a lot of the work that I will also do in task one is invite the griever to begin to distinguish who I am is different from my experience as a griever. And so in task one, a lot of the work that we're doing is going to be to talk about the deceased, to remember the deceased in a past tense, and then to be able to distinguish and separate who I am versus how I identify as a griever. So this is an activity that I have utilized with clients. I do have, if you have the PDF, these are clickable templates. There is a male and a female version of this handout. And what I have invited the client to do is to create a piece of artwork that represents the different parts of their person that they remember, loved, or want to continue to honor. So what are some of their characteristics or traits, and just invite them to begin to share and talk about their person that died. I've also, if the client is struggling to separate or differentiate their person and who they were prior to the death to that identity as a griever, I may also invite them to create one that represents who they are and one who represents the life of the person that died. And so this is something that I've utilized with children and also adolescents and adults. We've utilized this intervention in our support groups as well. It's a very simple activity. You can download the template. There's a male and a female version on here. And here we're just acknowledging the personal strengths and the attributes that we admired in the person. And same for the griever. A lot of times in the early stages of the grieving process, they may need some additional support in acknowledging their own personal strengths. What are your internal resources that you have to help you cope with this loss? So that is task 1. Any questions on task 1? Excuse me. No? All right.
Cindy, I've got a quick
Yes.
question.
Yes.
A while ago in the training, you had mentioned some children grieving people who maybe they don't have like a positive experience with. Would this activity be recommended for that kind of situation too?
Thank you. Sorry, I was taking some water. I think that there are factors that we will want to consider. If it was an ambivalent relationship, sometimes it is where there's both positive and negative feelings about the death. This may be helpful. I can think of a particular client that comes to mind that is in a situation similar to what you're asking, and had a lot of very negative views or beliefs about the person that died, but also very much wanted to change those negative beliefs and focus on the positive aspects and the strengths that that person did have. And so that might be an activity where that might be appropriate. And it may not be appropriate for other clients who really are not in that space to honor the positive characteristics of the person that died. So I think my answer is it depends on your client and where they're at, but that's a great point because this may not be applicable to all clients.
Okay, thank you.
Any other questions? You all have great questions. All right, so task 2 of William Morton's task of mourning is to process the pain of grief. This is, in short, to feel all the feelings. I think personally, this is one of the most challenging tasks of the 4 tasks of mourning because we're asking the client to be genuine with all of the emotions. Many times there is shame or guilt for feeling a certain way, and they may not feel comfortable verbalizing those experiences. So if you think about the example I gave earlier with the adolescent who felt relief that the chronically ill parent died, I imagine that those would be emotions that are difficult to express to anyone, right? To tell your surviving parent that you're relieved that your other parent died, or to tell a friend or family. There may be fear of being judged for feeling that certain way. So in task 2, what we're really doing is creating space for those difficult emotions. A lot of times grievers will avoid truly feeling these feelings because they're uncomfortable, right? None of us want to feel sad or angry or guilty or worried. And so many times we will suppress these feelings or mask them by keeping busy. And so I have had parents share You know, my child seems to be doing well. They're really focusing in school. That might be a way of avoidance, where if I really focus on my academics, I don't have time to think about my feelings. Or if I'm involved in, you know, 5 different extracurricular activities, I don't have time to be sad. The same for adults. A lot of adults will share with us, you know, I just keep busy. When I'm sitting idle, it's when all of these big feelings come up. So I will get up and start cleaning the house, because then I keep busy and I don't have to think about it. We naturally as humans are very good at avoiding the uncomfortable experiences that come with these really big feelings. So what we're doing in task 2 is really creating space to honor all of our feelings without shaming them, that there is no right or wrong way or good or bad feelings. These are just natural responses to your life situation. And so some clients may need to spend a lot of time in text 2, especially if they're complicated emotions that are arising from the death. I always think about a client who shared with me one time that she both loved and hated coming to therapy. And I asked her about it, and she said, you know, I hate it because this is where I really have to face my emotions. I try so hard all week to not think about it and push it down. And I know that when I come here and show up for myself, that I have to bring up and unbox all of this that I've been trying really hard to keep under wrap. But then talking about just what that does for her, and this is the love part of therapy, was finding relief and feeling as if she didn't have to carry all of that weight as she was walking out. So I think that honoring this process is so important, to acknowledge that the work that happens in task 2 is difficult, but also very rewarding, because we're finding that release of those heavy emotions. So task 2 is really anything that is going to invite the client to share all of those feelings and find a way to physically release them from their body.
Would task 2 also be where they would work through and unpack like lack thereof? Like, what if they're numb? What if there's no pain? What if they feel like shameful for not responding the same way maybe their family is? So I guess it would be like where you would unpack shame or guilt for not feeling sad about the passing of someone,
Yeah.
or like
And
not
that's
feeling anything.
absolutely. So we do get, I think I hear this the most with adolescents, is where they describe feeling numb or nothing at all. I like to honor and validate that is also an experience, right? Not feeling something is feeling something to a certain degree. So if they don't feel sad, and that's again why I always tell parents, especially, because I think that as caregivers, we have a certain expectation of what grief is going to look like. If I'm sad and crying every day, why is my child not doing that? Do they not feel sad? And one thing that I always remind them is that grief is not just sad. So they may be in a place where they find peace and comfort, and those are the feelings that are coming up for them, and that it's perfectly fine to not feel sad. So honoring whatever feelings those are, and if the feeling of numbness is there, just honoring it and holding space for that. Surely there are other feelings, they just haven't emerged yet, and so just creating space for that, it will happen in time.
Yeah, I think I was more so leaning into the individual, or like in this like hypothetical situation, the individual potentially leaning into peace and comfort versus I guess like guilt, shame, or sadness. But yeah,
So
thank you.
if you can think of grief on a continuum, so the way I explain it to caregivers, if you just kind of imagine like a line graph, grief being on a continuum, there's 2 ends. So there's adaptive grief. That is where we take our life experience, this death loss that we've gone through, and use that and converted it into something that is adaptive. So an example of this might be maybe A mother who loses a child to a drunk driver may become engaged with the MAD program and engage in advocacy and teaching and working with other youth about the dangers of drinking and driving. That on one extreme, or having someone who died by suicide to become an advocate for suicide prevention. So if you think of that on a continuum, on one extreme, that would be a high level of adaptive grief, where they've taken that life experience and adapted and grown through that death loss. And then on the opposite end would be maladaptive grief. So that might be an individual that turns to self-harming behavior, self-medicating, substance abuse, really just kind of spiraling into unhealthy or destructive behaviors would be on the other continuum. And so it's not necessarily good or bad feelings, but what we're trying to do is take the maladaptive grief reactions and move them closer. Some people may never get to the opposite end, right? That might not be realistic or what they hope from their grief, but we at least want to get them closer to a more adaptive way of coping. Grief is a lifelong journey. We will miss those people that died throughout the course of our lifetime and through the different milestones we experience. And so our only hope through therapy and our approach and goals for our families at the center is that we take those maladaptive reactions and give them the tools to make it a healthier, more adaptive way of coping with those challenging experiences.
Thank you. I appreciate that.
So for task 2, I'm going to share a activity that I do with our children. I do have the read out loud just that I'm getting from YouTube's. I thought it'd be easier than actually going through the book with you all. So this book is called Blue is My Happy. It's a fairly short one, so I'm going to go ahead and share just a piece of it.
My sister says that blue is sad like a lonely song. But my blue is happy like my favorite jeans and a splash in the pool on a hot day. Yellow is cheery, says my mom, like the summer sun. My yellow is worried like a wilting flower and a butterfly caught in a net. The boy next door says red is angry like a dragon's burning breath. But my red is as brave as a fire truck in my superhero cape. Pink's my favorite, my best friend says. It's pretty like a ballerina's tutu. But my pink is annoying like an itchy bug bite and gum that gets stuck to my shoe. Dad says brown is ordinary like a plain paper bag. But my brown is special like chocolate syrup. And a piece of earth that's just for me. Look, says Grandpa, green is young like a small stem stretching toward the light. But my green is as old as a forest and the statue in the park. My cousin says that orange is fun like a bouncing basketball. My orange is serious like a warning sign and a tiger on the prowl. Brr, Grandma says, gray is cold like the sky before a storm. But my gray is as cozy as a curled up kitten and the sound of soft rain on the roof. Shh, says my brother, black is scary like shadows creeping across the wall. But my black is peaceful like the still surface of a lake and the spaces between the stars. I guess colors are how you see them. And my blue is happy.
All right. Any thoughts for you as you reflect on the story? It's not a grief specific book. It's really just talking about feelings. It's one of my favorite. I know it's probably written for a younger audience. I've used it again. I don't just age discriminate. I've used it with adolescents, with adults. I think that it normalizes that every person's experience is different, right? So for her cousin, pink was happy, like the tutu. For her, it was itchy and uncomfortable. And so just recognizing that every person is going to experience their grief in a very different way and that their feelings manifest in a very different way, and just honoring that. So some interventions or activities that I've done, multiple variations of this. With our littles, I have created like their own little book. And so just kind of using construction paper or copy paper and creating what are the various feelings that they have when they think about the person that died. So they can list those feelings and then assign a color. What does that look like for you? For older adolescents, we've done artwork on a canvas and just representing all of the different feelings that they experience as part of their grief journey. And even with adults, we've explored how both they and their children may be expressing their grief in a very different way. And so even just recognizing and acknowledging that the way you express your grief as a grieving mother may be very different from how your child is doing that, and how can we identify those differences, but also honor that there is no right or wrong way. As in the story, there is no right or wrong way to identify how our feelings are represented through the use of color. So that's a quick and short intervention.
If I could say something real quick. Watching the video, it reminded me of, I have a couple of kiddos for clients, and we were doing an emotion-based activity. He's very like artsy. So we wanted to talk about where he feels emotions on his body. And so we had like a diagram of a body, and he was like coloring in where he felt each emotion. And he experiences a lot of fear. So he put purple for fear all over his body, like in an outline. But then in his head, he had put orange for happy at the time. And he put like a circle on the inside of the purple outline in his head. And then he put like a red like heart in the middle. And then I asked him to explain what that meant, and he said, I feel fear all over my body, but the happiness that I feel from like, and for his heart, like the red was his family, and he said blocks it out. So it was a really like interesting moment for him to see like visually what he put. That purple was fear for him, but that the yellow and the red had blocked it out. So it was a fun activity to do too. So
Thank you so much for sharing that. It sounds like he was able to identify like those protective factors that help him manage those difficult emotions. And so want to be able to identify like what is that challenging emotion, and creating space for that maybe even later down the road, but also, you know, bringing awareness and reinforcing his self-awareness to identify those protective factors. It's a really quite impressive for a little person. Thank you for sharing that. This book can springboard so many different interventions. Another one for preschools is called My Many Colored Days by Dr. Seuss. I use that one quite a bit as well. This is not the blue is my blue is happy is not grief specific. So I encourage you to use working with young people. There's so many different adaptations that you can utilize it with, and even just having conversations. I've used it even just to discuss and explore how feelings are manifest differently. I've also used it as an introduction for body mapping as well. So I'm glad that you brought that up. I didn't include it in my PowerPoint. I tend to be over ambitious when I'm doing trainings and have too much content and not enough time to cover it all. But that is another intervention that we utilize quite a bit at the center. Also, even just in our check-ins, when we see clients, we typically do just like a feelings check-in at the beginning. And we do invite the client to identify. So if they say they feel happy or sad, where do you feel that in their body? And so we're beginning to bring awareness of the physiological responses to their grief experiences. And so that's something that we introduce very early on, and we do the body scanning at almost every session when we're doing the check-ins, just to bring in that self-awareness. The next one is task 3, William Morton's task of mourning. This one is a big task. It is to adjust to a life without the deceased. And Dr. Worden talks about 3 different levels of adjustment. And every time that I talk about this task, it reminds me of just how big grief is. It's not just the death loss and the emotions that are coming up for that person, but also the day-to-day challenges that come up for the griever. So the one that most people think about is the external everyday adjustments. A lot of times that is, now I'm the primary breadwinner. We have a lot of spouses who say, now I have to learn how to cut the grass and do all the honeydews around the home and fixing things that I would rely on my husband to do, or vice versa. We have a lot of dads who sometimes share with us, I don't even know who my child's pediatrician is. I don't know what size of clothes my children wear. So learning just the day-to-day living of how to adjust to new roles and responsibilities. Same for children and adolescents. What are their new adjustments to their routine, and how things happen and function around the home? That is in itself a very big adjustment. But Worden also identifies the internal adjustments that happen when we experience a death loss. How is my sense of self different because of the death loss? So if I was a twin and my twin dies, do I identify as a twin? Or if I was the middle child and my older sister dies, am I now the oldest, or do I still consider myself a middle child? If I have a very strong relationship with the person, or we had a very enmeshed relationship, how is my view of myself going to be different because of the death and separation with that person? And then the third adjustment that Worden talks about is the spiritual adjustments to a life without the deceased. How has the death affected my beliefs, my values, and my assumptions around the world? This is especially true for those disenfranchised deaths where the individual may feel as if everything that they believe to be true is now no longer true. So that might be situations in which, for example, the loved one dies by suicide, and maybe the family had no awareness that their loved one was struggling with mental illness. They may begin to question everything that they experience and live through with the deceased and view it from a different lens. Or in situations of domestic violence, if my dad killed my mom, those were supposed to be the 2 most loving and trusting people that were led to believe about what a parent should be, right? And so if I can't live in a safe home or trust the 2 people that I'm supposed to trust, how can I trust other people in the world? In situations where sometimes someone may be a victim of crime, or if law enforcement was involved and maybe the policeman shot and killed my dad, the people that we are led to believe that law enforcement is safe and helpers caused this death to happen. Again, how do our assumptions of the world change based off our life experiences and the death? And so for some grievers, their values will change what they believe to be important prior to the death may be different now as a result of the death. And so the griever is not just feeling the feelings and experiencing all of the emotions that come with the death loss, but they're also adjusting to the day-to-day environment, the new roles, the new responsibilities, a new sense of self. Who am I now in relation to the deceased? And then a whole change in the view of the world around us, the community that we've built. Sometimes we have an expectation that my best friend is going to show up and be there for me and support me in that time of grief. And maybe my best friend doesn't have capacity. So the one person that I was expecting to show up for me can't or didn't, also is going to change my values, my beliefs, and my assumptions about the world and the people in my world. So there's so many things that they are adjusting to. And so in task 3, a lot of what we're talking about with families is creating a new normal. What can I do to establish new roles, new responsibilities? And there is a lot of pushback. A lot of times grievers will say, I don't want a new normal. I want things to go back to the way they were. But the reality is that we can't, right? Death is permanent and not reversible. And so how can we take our previous life experiences or ways of life that we enjoyed, and how can we adapt those to a life without the deceased? So in task 3, we're doing a lot of problem solving. We're giving them a lot of tools to identify coping techniques and interventions that are going to help them in aiding this process. But also task 3 is just adjusting to this new environment, and acknowledging it is really important part of that process. Some of the activities we do with families here is really like, let's just acknowledge. I've done like a little a chart graph with clients. It's like, let's talk about how things have changed at home, how have they changed at school, with your friends, in your spiritual community, and so on and so forth. And sometimes they don't even have that self-awareness of recognizing how much the grief has impacted multiple parts of their life, not just their personal and emotional responses to the death. So in task 3, I enjoy using this book. I don't know where my stop share. This one is called The Rosie's Glasses. I also have a YouTube video so you can see it a little bit better. This is an illustration only, so there aren't any words. And before I share it, I'll give you a little bit of what that looks like. But in this story, the little girl sees the world very much in black and white. She's noticing and observing all of the less desirable parts of her world. And one day she comes across a pair of glasses, and when she puts them on, she can see her life, her world in color, and she begins to see the good that happens around her. And so throughout the story, you'll notice kind of the different images. I invite you to just kind of take in the illustration, since it doesn't have any words, and then we can process that a bit afterwards. 1 second.
Glasses. Written and illustrated by Dave Wamond.
any observations you have about the book? It's okay if no one wants to share. I think this book lends itself really well to even the concepts that we discuss in CBT, right? So she was focusing a lot on the negative parts of her daily life, what was happening at home, in her neighborhood, even with the peers at school. And so when she put on the rosy colored glasses, she began to see her life, her world from a different lens. And so I've utilized this with clients. Let me go back to the PowerPoint. I've utilized it with clients to begin to explore what are some of those experiences that they've gone through as a result of the loss, and how can they begin to view that experience from a different lens. So one thing that that a client might share would be, well, now I get to spend more time with my mom because she has been more loving or attentive. So that's a positive aspects that I really enjoy about my my new relationship with my caregiver. Or I've recognized that there are a lot of people in my support system that are there to support me. So I just created, like on a Word doc, a template with the different circles, and so we talk about their view of the death and the challenges that they experience in terms of adjusting to a life without the deceased, and then we begin to explore what are some of the aspects, positive aspects of their situation, and how can we lean in on those new normal and those new routines that they're creating. And so this can be adapted in a lot of different and I've had some adults really appreciate this book as well. So just a very simple intervention, but we're beginning to have those conversations. I know we're a little getting a little close on time. This is the last task. I'm going to run through this a little bit quickly. But task 4 is to find an enduring connection with the deceased while embarking in a new life. This is where Warden talks about that our life doesn't end because somebody else's life did. And so how can I continue to move forward in my life and continue to honor and love our loved one? A lot of times before, I think when we weren't as grief informed, there was this idea that we should separate ourselves from the deceased or from our grief. But more and more there's conversations about incorporating our grief into our daily lives and incorporating the memory of the deceased into everything that we do, so that we are not disconnected, but rather connected with the person that died. So if you think about holidays, what are things that you or your family can do to continue to have the essence of that person? So maybe we play their favorite Christmas carol, or we decorate the Christmas tree with their favorite color. You know, maybe if grandma was the one that died, we're going to use her special recipe for our Christmas dinner. So that way it feels as if we're not moving on without them, but we're moving with them, incorporate their memory of them, incorporated into the life that we continue to live. And so we want to create opportunities for remembering and honoring the person that died. And in task 4, I have found this book to be really helpful. It's called The Memory Box, and I do have the link on here. In the interest of time, I'm not going to play it, but if you have the PDF, you should be able to click the link and watch the video on YouTube. In this story, the child talks about feeling disconnected from the person that died, and begins to interview people in the family to learn new things and new stories about the person. And she has a box where she begins to collect all of these memories. So keepsakes that remind her of the memories that she built with the deceased, and then also beginning to visit and do things that they talked about doing together that they didn't get an opportunity to do, but feeling as if she's still connected with him by continuing those traditions and those hopes and dreams that they had for one another. And so an intervention that I do with the client might be to create a memory box that can be done in session, or it can be done outside of session with the support of a caregiver. If the client doesn't have tangible items, sometimes some families have nothing to add to their box, they can create that in session or write it in strips of paper. So it doesn't necessarily need to be a box of actual mementos or items that belong to the deceased, but that can be modified depending on the relationship and what is accessible to the client. I have one more slide. I think I was asked this a little bit earlier. How do we know when a child needs help? These are some of the things that we want to consider if professional support may be of benefit for the child. Are the child's feelings interfering with their daily functioning? Are they so angry that it's difficult for them to do well in school? Are they so sad that they're dropping out of band when band used to be their life? How are these feelings interfering with their daily functioning? Again, it's going to look different for a child. If I had a child that told me, an adolescent that's maybe a junior, senior in high school, told me I was in band the last 5 years and I just can't be in the band anymore because it's too hard. To me, that's affecting their daily functioning. If that was something that they were very passionate and love to do, it might seem as if they're coping well, they're doing well in school, but if they're not doing something that was typical for them prior to the death, we want to just be mindful of the impact that the loss may have on their daily functioning. If it's impairing their sleeping, their eating, or they're isolating excessively, we want to be mindful of that and explore further. Any regressive behaviors, we talked about that a little bit earlier with children or adolescents. That is a natural reaction, but it also may require additional support. Repeatedly wishing they joined the deceased. Again, just exploring if they are experiencing any suicidal thoughts or intention of wanting to die or end their life. If they witness the violent event, and I want to add not just violent, but if they witness the death, even if we imagine that to be a very peaceful death, it may still be traumatic to the individual. So we want to ensure to provide extra support. If the child has little to no support system, whether the caretaker is not emotionally or physically available, or the family is in a space where they don't have other friends or family in the surrounding areas to provide support, they may need to have that sense of community to help them through that loss. And then lastly, are there drastic changes in their behavior, or are they engaging in risky or dangerous, destructive behavior? They may benefit from additional support. So those are just some of the things that you may want to look at when determining whether or not a child would benefit from grief support. And I think that's it. So my last slide is ways to support the center. I wouldn't be doing the center justice by sharing this with you, but just exploring ways that bringing awareness of the support that is available in our community, providing financial support, no donation is too small or too large, becoming a volunteer or intern. We do have various organizations that have helped host fundraisers, even like schools will host fundraisers to help raise monies or donations for arts or craft supplies. And then we do have a wish list on our website, including our Amazon wish list. As a nonprofit, all of our services are at no cost to the community. And so the support of our community and our stakeholders really helps us continue to further and continue our mission. And this is my last slide. It's our phone number and email website, and we are on Facebook as well. So if you want to follow us, I encourage you to do so. And I think that's it. Went over by 1 minute. I do have a few extra minutes if anyone has any questions. I want to be very mindful of everyone's time, but I can't spare a few minutes if there's any questions that anyone has that I could address.
I just had a quick question. I brought up like working with kids on the spectrum earlier too. And I know like y'all probably like integrate it differently depending on the client that y'all have, but do y'all have any like I guess more examples, like I guess on y'all's website or something I can talk to you about like separately in terms of working with kids on the spectrum?
Yes, I can. I'm gonna drop my email on the chat. Feel free to shoot me. Oops, .org. It's cwaddle.org. I'd be happy to discuss with you further. I do work a lot with children on the spectrum. The play therapy and interventions have been really helpful. I've had clients who are nonverbal who can still process and work through their grief through the play and also utilization of art and sanitary interventions. So those are great tools as well.
Okay. Thank you.
Also, I'll add one more thing. The National Alliance for Children's Grief, I did talk about that a little bit earlier. They do have a toolkit for grieving children with diverse needs, and specifically written for neurodivergent children or children with disabilities. So there is a workbook or a toolkit for providers on their website that is available for free as well. Any other questions? I'm going to drop on the chat the website for the National Alliance for Children's Grief.
I had one question. I put in the chat all the techniques that you shared about adjusting. What are the indicators that you've heard the feelings and that you validated them, normalized them, and the tasks in that phase, and there's a need to move to focusing on adjustment?
That's great. Again, it's not a linear process, so we're not going from task 1 to 4. Again, that's the model we use at the center. It's really meeting the client where they're at. If they're, really struggling with those emotions, we're going to sit in that space for as long as we need to. For some clients, that might be 1 or 2 sessions. For other clients, that might be 6 or 7. So once you feel as if they've resolved some of those feelings, we may be able to move on to the next task. And sometimes for some clients, they come in and they're in task 3. They're really struggling with adjusting to their daily environment. And that might be where we start. So it's just meeting them where they're at. It's not necessary. I encourage you not to view this so much as a linear process of when we move on to the next one, but what are they bringing to session, and what is their primary concern is where we're gonna focus on until you feel like they find some sense of relief in those emotions or experiences.
That answers my question. Thank you.
Mm-hmm. Right. I think that might be it for questions. Thank you so much for having me. It was a pleasure. I hope that this is helpful for you in some capacity. Again, we hope to be a resource, so feel free to email me, visit our website. I encourage you to use the National Alliance for Children's Grief for additional support, trainings, and resources as well.
Cindy, this was a very incredible, very helpful training, and it was an incredible training. Thank you so much for all the information you shared with us and all of your wealth and experience in this topic. It's a very special topic to us, and so we really appreciate you taking the time to train us. So thank you very, very much. Yes, it was very, very valuable. I'm glad everybody liked it. So you're getting a lot of thank yous in the chat.
Thank you. My pleasure.
So for everyone else, we're going to be taking a 10-minute break. And then when we come back, we're going to have another review on sand tray. And some of you who are new, of course, to TEXCHIP, if this is your first semester, we're gonna talk about sand tray. And I'm gonna share some videos. And I'm also gonna have us do some activities virtually. So we'll be back at 1:14 or 1:15.
Thank you, Cindy.
Thank you.
Yes, thank you,
Y'all have a
Cindy.
good
Thank you,
learning
Cindy.
day of learning. Bye-bye.
Bye.